Okay, we're ready to begin here now for everybody that's out there. It's 1 minute past 10, our time anyway. It's Custer County Board of Health meeting on Tuesday, November the 17th, 2020 at 10 a.m. I would like to remind everybody to mute your phones, and you can stay muted. We'll have time for public comments if there is any need to later on. And I also would like to point out that this is a special call meeting here to work exactly what the agenda item is, given the current status of our personnel in the county and the public school system and community in the Custer County building. So we'll learn more about that as we go along. So I would like to point out too, we have not got a replacement for John Adams, and John Adams couldn't be here. He's volunteered to be here as our secretary, but could not make today's meeting. So Dr. Brown will be the secretary for the board right now. And I would ask afterwards, Dr. Brown will find somebody to transcribe, help you with that. I'll look for a volunteer. And we'll get the live streaming from Vernon, and we'll work up the right minutes later to help fill in the holes. So with that, the board is called to order. Let's do the Pledge of Allegiance, and I'd like to have Dr. Brown lead us today.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, sir. Okay, if you would, Dr. Brown, read the roll.
Jay Prince.
Present.
Tom Flowers.
Present.
Flower.
Flowers.
I'm Flowers. Sorry, no S's. This is my list through the mask, right? Bill Kanda.
Here.
Clint Smith.
Present.
Dr. Robert Larson.
Here.
Yeah.
And do I need to?
You don't need to, it's just the board and you.
Sure.
And you're present.
I think so.
All right. Okay, we will not introduce the audience. We'll ask for names as we go around. We know who's here in the room. We've currently got that. In addition, we've got Kara Evans here. We've got Vernon Roth, who's working the video. So if we have any problems, I'd like to have anybody out there. If you're having a problem, don't be bashful. Let us know so we can clear up the audio if it goes out for some reason. We got, as we heard, Bob Larson out here in the hallway right now. All right, with that, any amendments to the agenda for anybody? I think so. I do not have any, Tom.
I've got some things I want to talk about. I don't know if we want to talk about today or if we're going to have another Board of Health meeting in the next short.
Yes, and let me mention, I'm glad you brought that up because I was going to wait till the end, but we do need another Board of Health meeting soon. And we'll pick a day because we want to clear up a couple issues that we've got to get. For example, some of the CARES Act actions, secretary post for the secretary, those kinds of things. So we'll do that. So we can talk about that toward the end of the meeting, but I think we'd probably be best looking for times. If that's okay, and you want to do it.
Depending on when we select it would dictate whether or not I bring up items during the board members.
Well, I want to do it soon, so it could be as soon as the next, after the meeting on the 8th, no, not the 18th, but next week. If you got a window there, we'll do it.
I would be available the 24th, 25th.
About you, Jay?
On Friday of those two. We have
24,
a
25.
CVRF meeting in the afternoon on the 24th, I'm assuming. Right?
Yeah, so you want to do it after that?
Or before, either one.
Okay, let me take a look at the calendars and I'll send a note out. We'll plan for the 24th for now.
Well, let's make a decision on the time so we have it on the calendar.
I can do it in the morning, can't do it before then.
Yeah, I'm good in the morning.
All right, let's look for 10 o'clock on the 24th. Everybody got that?
So I do have a few things under, are we under board members?
We're just
Okay,
an amendment here. We'll get to that in a minute. Okay, Jay, you have anything else?
No.
Agenda-wise? Work that. All right, let's look at the minutes and take a motion to approve them.
I'll approve the minutes as presented. I'll move to approve the minutes.
Okay, been moved. Got a second?
I'll second it.
Okay, it's moved and seconded to approve the minutes from the last board meeting, which was October the 21st. Any discussion?
No, sir.
Thought they were good. John did a good job summarizing, I thought. We'll pass that along to him, Cliff, will you? Okay, it's been moved and seconded. Hearing no other discussion, take a vote. Aye, go ahead. Candid, aye for Tom.
Aye.
Aye. Okay, and it's been approved. Okay, we have our couple reports and any comments from the board members. So Jay, you want to be first on anything to bring up?
No, I think,
Wait for the discussion.
well, I do have some discussion. I'm concerned about, and I don't know, this may be part of.
Yeah, I don't want to get sidetracked now. If we're gonna, we can do it with, listen to the report and then all over it. We could talk then if that makes sense to you.
Okay, I don't have anything to
Okay.
add.
Tom, any?
I wonder if there's a need for us to have a regularly scheduled Board of Health meeting moving forward while we're in this pandemic.
That's what I was gonna bring up as a matter of fact.
So
I think that's a good idea.
I believe that it would be in our best interest to do that.
We'll do it weekly or bi-weekly?
Well, I was thinking once a month, but if we need to have it more often, I would be open to that.
I think for sure once a month, and I think given circumstances, we can do an ad hoc like we did today. It's not, there's nothing wrong with that. Just got to have a 24-hour notice.
What about picking the mid-month, have it run concurrently after our mid-month BOCC meeting?
Okay, I think that's
With that.
a good idea. That's usually a less busy meeting.
So that would be December 16th.
And we've got,
And I'm assuming that those would have to be afternoon meetings because our BOCC meetings in
yeah,
the
let's,
morning.
I would propose 1:30 if we're going to do that. Go ahead.
The only thing I would bring up is we often have a task force meeting on this same day in the afternoon. I don't know if the task.
I think I think they moved that.
Continue.
They moved it.
Well, they certainly talked about discontinuing it. I don't.
Put it on Thursdays, I thought.
Well, I think Board of Health is more important, so I'd say let's.
We can move the task force. We're in charge of when that happens as a commissioner. All right, let's make it that way.
1 o'clock.
1:30.
1:30
Yeah.
after the regular schedule
Yes.
meeting.
That gives us slop time.
Okay. I think
So
that's
we've
fine.
got a staff meeting after the BOCC meeting on the 16th, but we should be done by 1:30. So.
Yeah.
So I would move that we, moving forward, schedule a Board of Health meetings in the afternoon of our mid-month BOCC meeting, whatever day
We
that
can
happens to fall.
vote or we can do it by consensus. I don't know that it matters. I'll hear a second.
I made a motion, so I'll second it.
Okay.
I don't care which way it goes.
All right, it's been moved and seconded to have Board of Health meetings, mid-month meetings after the Board of Commissioners meeting, 1:30. All in favor? Jay?
Aye.
Tom?
Why?
Canada? Aye.
Let me look here and see what's appropriate for today and what can wait then. Give me just a
I
second.
tried to make this broad enough so that we had the ability to make decisions on several things that might come up. This was to take a look at further actions and options. And it would be good to structure it that way.
Question I have for Dr. Brown, are you involved in where are we at with the illegal dumping by West Cliff Meats?
Since last week, I've heard zippers.
But are you involved?
Yes.
And then another question, I guess for you, Dr. Brown, is where are we at with the variable message boards?
Right now, we had to pull them because the state said we couldn't put them on. We just kind of said, we're going to try it, and we had applied, but they have not given us anything as far as space on the state right of ways.
They're still working it though.
Yes, oh yes, yeah, for sure. But they've told us we can't.
But we were gonna put them on a county right away somewhere, right?
Yeah, and trying to find a place that people actually travel on a routine basis is proved a challenge. Adrian hasn't come up with anything, and I haven't, I'm open for suggestions, of course.
And yeah, I was asking from your perspective as public health, I understand that OEM is kind of responsible for those, correct? But
Yes.
But you're directing
you
it.
guys have been working together on the messaging
Yes, sir.
and whatever. So, yeah, I continue to bring to the forefront my concern that those message boards are used for exactly the purpose we bought them for, and that is for COVID related stuff. And hopefully we will continue to do that. I think, we're bound by our word to use those for COVID because that's why we bought them. So I would just encourage us to stay proactive in getting those back out wherever we can. I can talk with Mr. Washington about that as well. And
Yeah, we are in contact back and forth. He just hasn't had any positive statement from the state yet.
I asked him 2 days ago where things were, and he said they're still waiting for
Still
them, but
waiting. That's exactly right.
I thought he was not waiting to find a county right away, so we'll have to talk to him as soon as we can. I don't see him online here, so. All right. Anything else, Tom?
I'll wait.
Okay.
I would request an opportunity again to address some things after we hear
Right, and that's the,
Cliff's report.
okay. And only thing I wanted to point out was, we've already mentioned, and then we will schedule a couple workshops. We have to, and then we'll schedule the regular meetings too. But we need the workshop in order to get, remember, it's a series of workshops for the processes that are necessary to operate the public health agency. So, all right. With that, Cliff, Dr. Brown, why don't you
Okay.
bring us up to speed on where we are with
Sure.
the county?
With Jay's query yesterday, I said, okay, fine, let me just make sure I'm not totally out to lunch here. Critical worker on the, I think it's the top page on the stapled handouts that I gave you guys. Critical worker could be substituted essential employee or personnel. It's on the very first page, the one that you just put back. Guidance can be implemented in the rare situation. And I spoke directly with Annie Gibbs last night, and she also emailed me with this information. So this, I believe, is essentially what we were following. The other concern that was voiced was the composition, the chemical composition of the misting machines that we have. And so again, I contacted, and they changed it this time on me, which is why I gave you one bit of information the first time and giving you another bit of information now. Basically, and as I emailed all of you guys, or texted, I don't even remember what I did yesterday. It was not a good day. The solution that's being used is not a pesticide. Okay, that's what I was told. He read it right off the box for me. It is used as a sanitizing agent, but it's made out of thyme. Remember old parsley, sage, rosemary, and thyme. And also, let's see the other one. I'm just trying to remember right now. Anyway, they're two seasonings that we use all the time, but they're using the oil of these seasonings, and it is very excellent fungicide, germicide. It even kills the virus. And so when we're spraying something we put on our food all the time, we might want to use it for food a little more often, but anyway, basically it's not a toxic substance to human beings. Yes, sir.
Dr. Brown, we kind of went pretty quickly over the first portion of your discussion. I'd like to come back to that after we're done with this, if that's
Oh, okay, I'm sorry.
on the critical essential worker.
Yes.
I asked Vern to join us today because Vern had mentioned to me that there were several people over at the sheriff's office that when this solution was used was not feeling good. And I asked Vern to look into this a little further because he has a science background. As you
Sure.
do. And I'm not trying to countermand you in any way whatsoever, but I originally brought up the question when we talked about misters. Are we going to create something more hazardous than what's going on already?
The virus.
And that's why I asked, could we see to make sure that what we're spraying is not going to deteriorate someone's health?
I'm open. Yeah, totally.
So Vern had some information, and I asked him to come here and just kind of relay it to us so we all are on the same page. If you would, Vern, I don't mean to put you on the spot, but I appreciate your efforts.
Thank you, I appreciate that. So thymol itself is actually classified as an insecticide and germicide and viricide by the EPA. And excuse me, the EPA has designated it as a cleansing agent. It is not meant to be used as a cleaner. And as I did the research, fogging a cleansing agent is meant to clear air. It is never meant to clean surfaces. It is only used to be used in conjunction with appropriate cleaning. So what you see for the fogging itself is in like hospitals and restaurants and such, which have a lot of clean surfaces and whatnot that they utilize the fogging for. In addition, the CDC and the EPA have come out with 7 very specific uses of thymol for use in COVID, and all of them include cleansing surfaces. None of them include fogging in the air. That said, and I'm not discounting anything that anyone anything that anyone else has discovered. I'm just saying that this is what my research has led to. It stays active for at least 5 days, even after it has dried. It is actually used mainly outside as an insecticide and barrier for animals coming into a vicinity, because the particles continue to rise up after it's dried and repels animals and keeps them away, as well as killing insects. So that's not I.
Are we talking about the same stuff that they're using here?
It's thymol is the active ingredient. Thymol is the active ingredient in the fogging stuff that they're using right now. What the proper use is, once again, to aerate, kill things in the air, and then use regular cleansers to scrub down surfaces and stuff like that. It is absolutely not to be used around electrical devices that are running. As a matter of fact, I found several data sheets saying fogging should never be used around running equipment. And also the other issue is that we're looking at a solution that is being used, and maybe the dilution solution is not correct. We're looking at over 100 parts per million. The safety threshold we're looking at was at 10 parts per million. So it stays active for 5 days. It stays not alive, but it does not break down for 5 days at a 10 part per billion solution. But what's actually being used is over 100 parts per million solution. So an order of magnitude larger than what was recommended for the situation. As I said,
That's what the sheriff was doing previously.
yeah, as I said, multiple people over there are actually having respiratory problems, difficulty breathing that is lasting for hours. Even if they do it at night and then the person comes on the next night, they're discovering that. And the deputies are also getting headaches. So the fear is, as it was stated by somebody in this building, are we giving ourselves cancer 10 years down the line to save ourselves from COVID? And I'm not saying that that's a reality. I'm saying that is the perception. So my research, basically, that's what my research has led to. The fogging, actually, the people that do professional fogging are saying this should not be ever used for COVID cleansing on surfaces. It can never take the place of cleaning down surfaces. It can only be used to cleanse the air.
Was the sheriff using it like that?
I don't know the answer, sir. I know that they're using it. I know that they're using it throughout the entire building. So
They are, but well, we did, as a precaution, cleanse it while everybody was gone on Thursday, Friday.
yes, I understood. And I'm not saying that one use is going to be detrimental. But continual use, like I said, it can never take the place of actual cleaning surfaces. And it can never actually do more than cleanse the air. It can't cleanse papers. It can't cleanse carpets. That's what foggers are for, is for the air.
Mm-hmm.
So we have, like I said, we put in air filters that can clean the air at night too. I'm just proposing other solutions. We've got the air filters, we've got the UV system. If the cleaning personnel can come in with UV lights, we can eliminate. I'm not saying we don't use it, I'm just saying maybe we need to reconsider whether or not we use it at all. And it is naturally derived. Yes, absolutely. And I like to point out, I had heavy metal poisoning and almost died of 2 heart attacks at 22 because of natural spring water. So just something to think about.
So the county bought 2 foggers.
Yes, sir.
And what kind of solution did we buy with it?
It's a 0.23% solution. The rest is an alcohol and propylene base that I don't know if it needs to be diluted or not, but
So the active
at that
ingredient,
concentration level, yes, the active ingredient is thymol.
still thymol.
Yes, the active ingredient is thymol. And like I said, I don't know if it's supposed to be diluted, but I did calculations and that puts it at least 100 parts per million. Whereas the tests on that actually do cause rodents respiratory distress is actually at 10 parts per million. So we're literally 10 times over the over what the threshold of what the studies were done at. The EPA, like I said, the EPA does recommend 6 or 7 thymol products, but none of it was fogger based. It was all the spray on and then clean off of surfaces.
So if you have a fogger base, can you still wash it?
Well, if you have a fogger, you can probably wash down the surfaces.
Sure, like you would anyway.
Right. Well, and the EPA does actually say that. That's the process. The fogging does not countermand or override the need to actually clean surfaces.
So we have to have a process here if we're going to.
Exactly. If it's used, if we're going to use it correctly, and if we are actually going, I believe that if it's to be used correctly, and if we are going to use it, we need to use it in a proper format. Wipe down the surfaces to get rid of oil and grease, fogging, then wipe down the surfaces to clean the substance off the surfaces.
So we can consider that as part of the discussion. We can come up with how we want to handle that.
Was this already used last Thursday?
What's up?
It was used Thursday and I think Saturday.
Okay,
I got to talk to Stephanie about Saturday.
okay. And what is the proposed usage? Was there proposed usage for the future, or
That's what we
was
need to
this
discuss.
just a
That's
one-time?
good
I thought it was a one-time shot, but
That's what it was.
okay. So,
That's the summation of my research.
okay.
And I can give you sources for all of that. Yes, sir.
Thank you.
Tom?
I don't want to dispute what Vernon said. I appreciate and respect his research and the time to do that. Through my research, my opinion is that thymol is not an insecticide. It is used in insecticide, but in and itself is a plant-based derivative of the thyme oil.
That's true.
So I think it's critical that I think it's important at least that I share my opinion based on the research that it is not an insecticide. Not going to argue that they don't use that ingredient in insecticide. The solution we used was contained thymol at a 0.05% solution, 0.5% solution, rated by the EPA to kill 99.9% of germs, bacteria, and viruses that it comes in contact with.
Was that the jug that the sheriff gave us?
That stuff we used, yes.
That's
the
why I asked
solution
Vernon
we used.
if that was the sheriff's.
I can give you the brand name. Give me just a second.
You didn't see that jug, Vernon?
Bio-esque botanical disinfectant solution contains 0.5% of thymol. So I think probably that there's justifiable concern about the use of the foggers. We never got to the point of deciding when we were going to use them, how often we were going to use them, what solution or dilution we were going to use. We kind of got caught in the whole thing of the last week with the contraction of COVID by an employee that certainly did not come from this office, as reported in the press release. That was in error. It did not come from the commissioner's boardroom. So my understanding was that we were going to fog this last Thursday, late afternoon. There was no other plans to fog beyond that I'm aware of. If that decision was made, I'm not aware of that.
No, it wasn't, as far as I know. And the only thing that couldn't be done Thursday was the courtroom, and they did the courtroom later.
Correct. Yeah. So I guess based on where I'm at right now and the research I've done, I would recommend that we consider fogging the county building once a week, Friday after work, when staff comes in to do her job. I think that would be a reasonable approach. No doubt there's a lingering odor from that. I don't believe it's offensive. I came in after the fogging last week and could smell that, but only to notice that there was an odor.
Right.
So I know people say, oh, I might be allergic to that. Well, maybe, I don't know. Yes, time will prove out for that. But for right now, I think if we fog the county building once a week after hours, I think we'd be fine.
That's a thought. How about we'd also want to include wiping down and afterwards cleaning the surfaces in a normal way. Maybe it's a day later. We do it at the end of the week. You can day later clean everything. We got to think about a process. You want to wait, and vote on this and discuss that down here later, or do we want to?
I just bring it up as a
I
point
think
of
that's a
discussion.
good point. Okay, thanks, Cliff. Jay?
Dr. Larson, would you like to jump in on this discussion? I would love to hear what you have to say if you have something to add.
I don't think I have anything to add.
Okay, well, thank you. I don't want to put you on the spot. I just know your background.
So anyway,
All right,
sorry
so
to
let's,
derail us there a little bit, but you're welcome
Vernon?
to proceed.
Quick question, Tom, do you have a picture of that bottle? or
I do.
something?
I'll send it to you.
Because I was given 0.23%, not 0.3%, or 0.05, excuse me.
Yeah, I'll send you.
Why don't you send it to him,
the-
and take a look at it, we'll clarify it and then come up with the right dosage.
Yeah, I may have misspoken.
Okay,
The EPA's recommendation for thymol dilution is 0.05%. I'm
okay.
not saying that's exactly what was
Okay.
in this.
The solution that was used was 0.23%.
Okay.
So we can talk
I'll
about
send it
that
to you.
in a minute, and then Vernon, you be prepared to be kind of the lead guy to make a recommendation on how to do this later on. So
Okay.
we got to have a process, so and we'll make sure Stephanie knows how to do it.
Well, I would
And we're,
respectfully suggest that would come from public health, not from our.
I agree.
Director. Well,
but no, I always
just saying
saying,
for him to be prepared. to
well,
take the
all I
lead.
meant by that is he did a good job and he's an asset for Dr. Brown. And as a matter of fact, he is on his team. So we can look forward to it.
And all I had asked, Vern brought to me the question of some of the people at the sheriff's office were not feeling well after the spraying. And I guess the assumption is the cause and effect, but I don't know, it could be anything else. And Vern said, is it okay if I look into it? And I said,
Yeah.
please do. And that's why I invited him there. It wasn't to
I get
circumvent
you.
anything that Dr. Brown had to say. But I just have this issue always of putting poison in the air. You know, I know there's a terrible virus in the air at the moment. And putting more poison in the air, are we going to create additional issues? And that is my concern.
Good.
And that's why I asked Bert to please check it.
And I certainly don't consider the fogging solution any kind of a poison whatsoever, but that's my opinion.
But your point generically is we don't want to put poison in the air. That's the issue. And we want to make sure we're not. That's all.
Before we subject all
Right.
of the folks in here, I want to make sure it's safe. That's
I get
all
you.
I'm concerned about.
Okay, good. Okay, now we need to continue so we can get through this before noon today. And do it right. I mean, we're not, and I want to hear the rest.
Timeframe, I think we need to.
No, we're going to take as much time as, I just made
Speaking.
a flippant remark is all. I'm not saying we're limited at 12, so have a sense of humor here. Okay. Cliff, we still need your report on the status of where we are, so
Yes.
finish up. That was a good discussion. Thanks.
Yeah, and the research that I did came up with very much the same type of thing as what Tom was saying, okay? That the EPA said, we're good to go. No, you can't increase anything in concentration. If you drink too much water, you get in trouble. I mean, you know, so we just have to be careful
Okay.
where we're going in. Okay, for where we are right now, and the actions that we took, I spoke with the head of the Team 4 epidemiological team and communicable disease branch, again, just to make sure that I wasn't crazy, last night. And she said, and I put this statement for you so you could literally read it, and you can substitute, like I said, essential employees, which is a term that I threw out for you on, when it was the last Wednesday, when we met, for critical worker. So it's the same meaning. Basically, when you have a situation where you don't want to shut down all services and so on, you can allow people to do their jobs, so to speak, but they must have, in my opinion and in her opinion and seemingly in the state's opinion, you must have the testing done, which we did. You must have, and after 7 days after exposure, you must have some masks on. You must have the distancing. If you take off the mask, don't be close to anybody. So keep the picking mask on your face, you know, when you're inside, especially inside buildings where you've got to stay in there and other people have to stay in there for an extended period of time. After work, just like you did with the deputies. You go home, you stay home, you're not in contact with other people.
Make it clear, that's for people that haven't been positive tested.
Oh, yeah.
They've had a test, but they've not been,
Yeah, quarantine is a totally separate issue.
you have a positive indication on a test and you must be in isolation.
That's right, exactly. This is a totally different situation. So the person who tested positive here in the courthouse is in isolation. She will be for her full period of time. Okay?
Can I stop you there for a second?
Yes,
So-
sir. Go ahead.
So you know for a fact she is in isolation versus quarantine.
That's what I asked her to do. Yes, I haven't stopped by her house to check, you know, but yes, that's exactly it. She's not in contact with people from the best of my knowledge and what she told me.
Okay, so that being said, I just want to visit again publicly quarantine versus isolation. According to CDPHE, quarantine is to stay at home unless you're going out to be tested. And isolation is to isolate yourself in a room away from anyone, including your immediate family.
Yes, sir.
Okay, thank you.
Absolutely. Absolutely. Yes, sir.
If I follow up on that. First of all, I did a lot of research on this. I couldn't find anywhere where it talks about essential workers versus non-essential workers, and an essential worker can throw the rules out of quarantine and just follow the state mandates of wear a mask and distance anyway, because that's what you're saying. My understanding is, I don't mean to put words in your mouth, that's what you're feeling, that a quarantine for an essential worker is wear a mask and stay 6 feet apart. which is exactly what the mandate is anyway. So that's really not a quarantine, that's just the mandate from the state.
Except,
Hang on, I'm not done.
well, you made a
I'm not
misstatement.
done.
Okay.
So then I went to try and find out what is an essential worker? Who qualifies as an essential worker and who is not an essential worker? Okay, because that, even if I accept your definition that essential workers just have to follow state guidelines, even though they have potentially been exposed, which I don't accept, but if I did, who is essential? And this is the only definition I can come up with, and it's from the 2013 Essential Securities Act, federal government, and it says, essential employee is someone who performs work involving the safety of human life and protection of property. So then I start to think, how does our clerk and recorder's office, where is the hotspot of the county at the moment, how does that fall into the definition of an essential employee? Do they protect life or do they protect property? In my mind, and it's up for debate, of course, that's not true. What they do, registrations, marriage licenses, filing legal documents, and a myriad of other things that are essential for the running of the county. But I can't see this as part of life and death. I just don't see it, or protection of property. So calling just anybody who goes to work essential, to me, is a problem. For example, part of the discussion I read on what's an essential and what's not an essential employee, if you work in a bakery, a person that mixes the dough is essential to that employee. But is this an essential employee for the protection of the community? I would have to beg no. I am very concerned about this virus, and I'm even more concerned about exposing not only our employees, but our guests who come here with a mask or without a mask, because it's not, in my opinion now, it's not essential. There is no life or death situation or property harm that is going on with the quarantine. So in my mind, that office ought to be closed for 14 days. The people should be tested not immediately after the incubation period, so that if they were exposed, it has time to show up on the test. And I know you agree with that. But, and this is just me now, I recognize I may be overdoing it in terms of shutting down the courthouse. I'm not interested in doing that, but at least the office or where she was in, where the individual who was tested positive, and that name's been out there, so I don't mean to, and she authorized me to use her name, but in the offices where Kelly was close to us, I think they should be quarantined for 14 days. Quarantine in terms of what the definition of the CDC says, the Colorado Department says, just like Tom said, stay away from people for 14 days and get tested during that period. So I think we're shooting loose and fast with our employees. I think it's wrong. And I just need to make that public statement. I'm done.
Okay, you made a good statement, and we'll defer action on that until we get down to it and discuss it. But I wanted to point out one thing that I'm trying to, there is a difference in the mask that we're demanding they wear, and that's the KN95, which, if you believe science, and the reason you must, because you've got it on, keeps you from infecting somebody else or getting the infection back in theory, especially if you maintain 6 feet. So, and essential workers, we can discuss later. We can define essential workers as the leaders in this county in order to protect livelihoods and lives as well, because there's other things to take into mind. So I'm not going to debate it now. I just wanted to point it out because you made a long. So, and we can talk about what are good things to do here.
Well, I would like to today, whether you do it now or sometime in the future.
Well, we will. We're going to do it here when we get down to the,
Okay,
because
that's great.
I want to hear the rest of the story.
And I respect that and I appreciate that and I'm happy to wait.
Okay, good.
So, Dr. Brown, I am not condemning anything you said. And you and I had a conversation yesterday. By the way, I hope your animal is okay.
You dead.
I'm so sorry.
They're going home.
I'm so sorry. I knew you were at crisis yesterday. I apologize. But anyway, like I said yesterday, I'm not discounting a thing you have said or done. But as a policymaker, not as a medical professional, I personally feel we need to do whatever is necessary to protect the health and safety of our employees.
Okay.
So that
So what we're going to get into some more details so that
I
we
was
can
talking
understand.
to Dr.
I know,
Brown.
but you said the same thing again. So I'm just trying to.
Yeah, it's okay if I
trying to
reiterate.
work. That's okay, absolutely. All right. Then I want to get into more details later.
Okay.
Go ahead with the status. We're out.
And I apologize for going off track a little bit, but I was a little concerned about what we were discussing, so I'll shut up now, maybe. Maybe.
Go ahead, Dr. Brown. Please let us know the rest of
I'd
what
like
you
to know the
got.
numbers of where we stand.
That's what I'm going to do.
We had one more positive, just to answer directly. This morning, we had no positives yesterday, but understanding that the testing was done on Thursday, it's going to take, it was sent in Friday, so Saturday, Sunday, Monday, we're pretty clear, but we had just one. We didn't have 5 or, something like this. Last week was the worst week we've had a long time, but we also had all of our testing, like just.
So give us the numbers for the record, Dr.
Okay,
Brown.
we had 17 in 1 week in a 7-day period.
Mhm.
17 positives.
Was it localized or mixed?
It's a mix because people go wherever they want to go to get tested. So I've had the directors of public health from other counties phone me up and say, by the way, this person was tested in our county and they actually turned up positive because we didn't have them. It wasn't on the state record yet. And it certainly wasn't for us yet because we get our information out of the clinic. So thankfully, other people are sharing with me. So I have, eventually all of the names show up.
Population wise, young, old, school, community,
It's not
diverse.
limited to one or the other. I mean, we've had two children, pediatric population, anybody 18 or under, okay? But we have not had other children to my knowledge. Now, there is a community within our community that I don't have exact numbers on or anything like this, and all I have is reports because we know that these people are getting flu-like symptoms that are lasting for several days to a week, and they don't ever come in to our clinics, so I don't have any way to give you those numbers.
You're talking about the Amish in particular, or just in general, homeschoolers?
That's the community that I'm dealing with here. Because the homeschoolers, we've not had that. They've come in and tested. They've been very, very compliant to the best of my knowledge, wearing masks and doing the things they're supposed to do when they're asked to do it.
Okay, Tom's got a
I'm
question.
sorry.
Back to your report on the numbers, did our county employee show up on Cedars?
Eventually,
Eventually meaning when, to the best of your knowledge? She tested positive
on Wednesday.
on Wednesday.
And I believe that she was already there on
4th is when
Friday.
she tested, or
On Friday, when I checked through Cedars on Friday, okay? So she was already there before the Monday, which is why, so we didn't have any additional positive tests.
So other than her telling you initially, I'm assuming,
Yeah, she phoned me immediately, and then it showed up also. in
I'm
Cedars.
just concerned about how public health is informed of the positive cases. It should be through the Cedars report, correct?
Yes, sir.
But I understood that you didn't get that then for a
It has
while.
been very frustrating this last week because we were getting, I could eventually go in and find it, but it wasn't showing up on our list. And they explained it to me by saying, well, if they did the investigation very quickly, then they'd remove it from the list and put it elsewhere. which I found interesting, but anyway.
And then how did you find out about our positive case today? Was
That
that
was on Cedars.
Cedars? Okay,
Yes, it
thank you.
showed
I
up.
just am very concerned that either Cedars is working or it's not. If it's not,
Yes.
we need to raise hell with somebody about it.
And I have been, I'm sure they're sad to see my number come up on their phones because I've been vocalizing my complaints. Okay, I'm not happy.
So they backlogged, is that what they're trying to tell you?
They are backlogged. The labs are backlogged. They're slowed down and then it goes.
Are they
into
labs only in
hospital.
Colorado? What
Well,
happened?
Yeah, and what happened was that this is what it was explained to me. The government sent out a whole bunch of kits to all sorts of people. And so all sorts of people, not just the clinics that we're used to, that report electronically to Cedars. Then they're starting to have to handwrite everything in and send it in. And then somebody else has to enter it
Enter it
in,
in.
which just slows the process when you do.
So
it.
you could have a 3-4 day lag and people are walking around with a positive test, not
Yes,
knowing
sir.
it.
Yes, sir. Exactly. And that's my obvious contention.
So when do we expect our people that got tested on Thursday last week to be notified?
Depends on where they were tested.
Yeah.
Right, most of them were tested
Most of them here. And Heather gets the clinical director at our medical clinic gets her information about 4 o'clock every morning. Okay, so when she comes in, we speak because I actually call them and we
Okay.
talk. I'm talking about the patients now, sir.
Yeah, you go ahead.
Yes, sir.
Dr. Brown, do you have the totals on, since we started testing, how many positives we have? Also, if there's anybody in the hospital at the moment, or how many
We have
hospitals?
no hospitalizations.
Right,
And I'm trying to picture the board where I have things, it's 40. I'm sorry.
Well, today with that positive should be 49 then.
Yeah,
according to my
should be,
count, but-
we have to add one. Yes.
okay, and that includes the 17.
Yes, sir.
Okay, thank you. I just wanted to.
That was since the 1st of March or whatever it was.
Yes, that's the first one.
Okay, thank you.
I'm sorry for not being able to.
That's okay. Look, you can't do everything.
But anyway, so this is the week. Remember one of our newscasters back in the 60s, this is the week that was. This week changed a lot of things for us. And I have yet to be able to ascertain, because I have no information to do so, whether it was because so many more tests were done this last, 2 weeks ago, effectively. And so all of those that were walking around asymptomatic, not knowing they had a problem in the world, we had some people show up
Sure.
positive. Okay. We also have had some people who are actually symptomatic. That's a different category, but basically we had a glut, and I'm watching this week to see if we have another one, if it's actually following the stream, because we have, and I wrote this down, we have 248 cases that are positive in the jail at Pueblo, and there are only 342
Holy crap.
inmates. I mean, that's a lot of people. Tom got these great signs. I'd like to put a bar so we don't let anybody come up the canyons. I would like to shut down that pipeline, but I can't do that, of course. I'm being semi-facetious, but this is so rampant in other places. I just don't want to see it here. Obviously, none of us do. And what I do want to see, and we're finally getting people showing up to get fit with masks. I mean, the message is finally coming through that it really does make a difference. So as Dr. Larson said, when we talk through one of the cloth masks, it's about 3 feet. I mean, it's slowed down. It's not 6 feet or 8 feet or 10 feet. And it's not a sneeze at 200 miles an hour, air exiting our body, but it's 3 feet. And then when we add these on top of that to protect our people, we have some pretty good chances of staying clean, and us, because it's not going to allow the virus through, keeping them clean if they are clean truly when they come in here in the first place. So that was the thought process for keeping all of our people, so we not only protect each other, but we protect all the people who we're serving. And with that, as long as they are forced to wear a mask, and I walked in, when was it? Was it yesterday, Tom, that, yeah, I brought in the mask?
Yeah.
I walked in, there were 2 people standing in the clerk recorder's office with no mask on. I thought the agreement was that anybody who doesn't have a mask doesn't get served.
I think that's another process thing that we need to discuss, because I think our employees should ask them to leave if they don't have a mask and come back with a mask. That's easy to do. I don't think we had ever discussed that yet, and so they didn't know, I'm sure.
Right, right. I'm not criticizing, I'm just saying I'm concerned.
Right. If the rules are followed exactly, we're okay, but if they're not, we're compromised.
That's right. We are.
So can I ask a question if I may, please, sir? With the additional 17, does that move us beyond from yellow to orange?
You know, it's an interesting dial, so to speak, as they're using the nomenclature. Everybody, and I've spoken with Ms. Gibbs and Mara and others, say each county, each situation is different, because out where we are, we take it by percentage points in Denver, but that's very much different than us. If we have 1, it will change us more than their whole percentage
Not a
be blown out of
percentage
the
of
water.
population. I
Exactly,
understand how that-
exactly. So anyway, what we have been doing, following through, is between around the yellow green. So I said, okay, these are our restrictions. And instead of staying on the green and just watching real carefully what we okayed and what we didn't okay, what I'm proposing to you guys is that we move to yellow right now until we know whether this last week was a forerunner of what we're going to be experiencing.
What does yellow do to us?
Yellow cuts us down to, I believe it's 10% instead of 15%, and then into green is 20, you know, they just go up.
So what does that mean, though?
Congregation of people allowed to be in a place at the same time. So it really does cut us down to about 10 people, which could really and will really limit a lot for some of the people with large families when they want to get together for Thanksgiving. But I'm sorry, I think that's the way it is right now.
I don't think you apologize. This is
I don't
where we're
apologize.
living. I mean, what are we going to do? We have to just say,
Well, if I may, do I understand it correctly? We're not going to get to decide what color we are. The state will decide what we are, and I think they're getting ready to move us to red.
I went through with them on that yesterday, and there are several other directors who are doing the same thing. So you mean you are telling us what we are going to do? And she backed down very quickly. So
She being,
Mara is the chief of staff. So I don't know yet. I can't give you an answer on that one, Tom, for sure yet. But I know that there is a big push, and that was the rumor that I was responding to when I was making my phone calls. So I understand what's going on in Denver, other places, but I want to know that this is necessary for us.
but I don't think they're concerned about Denver when they're talking about Custer County. They're looking at Custer County's numbers saying you guys are in trouble down there.
And we do not I have not yet received anything like that. In fact, her direct response to me said, you will receive a directed statement from the state to you as Custer County if you end up on that list. And so what they have done in the past, to more answer to your question, is they sit down and say, okay, what are the factors that are contributing here that are building one way or the other? Are we going down? Are they going up? And what was there something that was a sudden event that brought the numbers up?
You might make so it's public record. what those criteria are, things like population, things like what the county, each county is
Well,
specific.
if
So
there's
they're
a-
going to look at the.
Yeah, if there's an outbreak in the jail in your community, okay, that's considered significant. If
Or
there is a lot,
hospitalizations, those kinds
yeah,
of things.
if there are a lot of hospitalizations, if one person in the hospital gets sick, then they potentially have been treating and dealing with lots of patients. So that is one thing. It's not saying that the whole population is.
Right. So since we don't have a hospital, they're going to look
Right.
at the school, the
Clinics and
clinics,
schools, yes.
whatever.
Yes.
Right. Okay.
And as of today, we are off from the young individual who was positive, who tested positive. He is out of isolation. So,
Good friend of mine.
yes. So anyway, that's information that I can't give you yet. I can give you more probably by Thursday, and I will. I try to keep you guys in the loop.
You know, give us what you got. Mr. Chairman, Dr. Larson Edison.
Oh, I'm sorry, I didn't see you. Go ahead.
Yes, I was just going to bring up a concern. I looked this morning on the state website. They have Custer County at orange. So what they told you is one thing. What may be publicly available may be somewhat different, and you may have to deal with that at some time in the future.
I know they did that one other time and they took it back after understanding how somebody put in a formula and it was wrong. So we need to check on it.
Yes, and again, I'm going back and forth with them all day, trying to find out
Okay.
if they're going to impose but I moved us, in my opinion, what I'm doing as far as making decisions when people ask me, I've moved us out of the green and yellow. So we're yellow, orange now. We're not where we were. Because if we lock ourselves into one thing, we can't be nearly as flexible on meeting changes within our county. Then we have to start to pay attention to everything else that's going on in the state. But right now, the concerns that I have are whether or not we are really self-infecting other people, with our people, or if it's totally being brought in. If it's totally being brought in, like I said, I'd sure look like it. I would love to see a gate, somehow to limit.
Well, until we go back to a stay-at-home order, we're never going to know that.
Right. Is this public? Have you put this on the website, the metrics that you gave us?
Not this morning. No, I haven't.
It says effective Friday.
I put something out on Friday, but.
Okay, it doesn't
I don't
matter.
have a
It
copy of what I gave you.
probably ought to be, just so people understand what the state is looking at and what we've got.
I spend a good portion of my day answering specific questions.
Sure.
of
I
people
appreciate it. Thank
who
you.
bring these things up.
Okay, you got more?
I also wanted to just bring up for the record that the EOC is going through a level 1 activation. I know that Adrian right now, Mr. Washington, is over in Pueblo, which is a little risky, but anyway, being in Pueblo, going through so that he can understand better what they are saying and how to interpret messages from them, so that there's not confusion on our end of things. So right now they have ramped things up. They have ramped up the restrictions. Everybody is more on alert. And what this translates to us is that there's going to be daily communication from him to you guys and to the public instead of weekly or some other.
So you said EOC, just for everybody that's on, it's Emergency Ops Center.
Yes,
And
yes, that's right. Emergency Operations Management. So they have actually stood up a unified coordination center.
they being the district.
Yes, I'm sorry. Should not use adjectives, pronouns. Anyway, that's what's going on there. And that's nothing that you guys are obligated to deal with or anything like this. I just want you to know what's going on. Okay. Relative, yeah, so when you turn over in your little colored pictures up there in the charts, we were functioning on a blue to yellow, and now we're going from in my mind, if you accept what I'm talking about here, yellow to orange. So I'm pushing, and once again, this is potentially changeable from day to day, but I want to make sure when you see down there at the bottom, you'd ask, what is that? How does that translate into personal gathering size? So as we have Thanksgiving come up, there's no difference between the yellow and the orange. When you look clear down at the bottom in personal gathering size, up to 10 people from no more than 2 households.
Okay, just real quick, before you continue, then your recommendation to do that was based on the positivity rate or
Yes,
something else?
that's right. It's based upon the number of positives we've had show up in the last week. Again, if this is a glitch,
And the number you're using is what?
17.
Okay.
And now it's 18 as of today.
Against what population?
5,000, 4,720, I believe. That's what I was told anyway, when it was given.
You're right on.
Yeah, just make sure everybody hears it.
Okay, thank you. So nothing has changed essentially for our Thanksgiving celebrations from blue clear up to orange. Okay, it's up to 10 from no more than 2 households getting together. Up to 10 people maximum. So all of those stay the same. When you go into red, like they are in Pueblo right now.
The number you just gave us was for yellow or orange? What
I'm saying, they're
I know.
the same.
I know.
Yeah. What I gave you, as soon as I know whether it's changing further or not, then I can give you yellow
Right,
or
but the
orange.
positivity rate for orange
And
is
that's what I'm
great.
talking about. Yeah,
It's less.
Right.
It's 15%.
right. Yes, sir.
Tom asked this question, and I'm not sure I heard the answer, or
Okay.
maybe I'm confused. Is it you, the state, or Board of Health that determines what, I mean, are you making a recommendation to us? Does the state just tell us what we are? Are you telling us what we are? I mean,
In the
just
past,
procedure, I'm
yes,
curious how it
of
works.
course. In the past, and I'm sorry for not explaining that better. In the past, the state has made recommendations, okay? And I've looked at, well, we went 2.5 months with no positives at all. So I said, well, your recommendations are great, but we're going to just kind of stay here and we'll watch and see what happens with us.
Okay.
So, and I confer constantly with Ms. Gibbs and other people, Coons, and other people there in the state organization to check to see if we're going to miss, if we're playing Maverick or something crazy out in the middle of nowhere. And so far they have been supportive. Said, yeah, this makes sense. Our plan for the courthouse, they said, okay, this makes sense. It's not for the general quarantine. We're not following. We're talking about essential workers, people just to keep the abilities of the community to function.
So the state is not dictating to us, you are now this.
Not yet. And that's what I questioned yesterday. Is this what you guys have coming? And that's what Douglas, I won't mention all the names, Jason, so the other directors said the same thing. Are you telling us that you're going to dictate all of a sudden and say, this is the way it's going to be?
What does dictate mean? Is it an order or is it a recommendation?
Dictate says it's a requirement.
Right. So, they haven't done that.
No, they haven't as of when I left my computer.
Okay, so from my understanding, we could make it red if we wanted to.
Yes.
We are in
absolutely.
charge of this county.
Just make it green. And we'll go
We
down
could make
the
it
line.
green if we wanted to do that too.
Yeah, but it is your choice.
But it's our job.
So, okay. So the question was, there were 3 potentials. One is the state, we just nixed them. Then my question would be, are you authorized to say we are now whatever color? Orange. Or is that your recommendation to the Board of Health to say, I recommend orange, and the Board of Health makes it orange?
Right.
I'm just curious on how the process works.
I am authorized to do so, but I have chosen not to try to dictate to you because you guys are the elected officials. I have no election involving my statement at all. But I make recommendations to you and then
Got it.
I will follow whatever you guys tell me.
Thank you so much. I appreciate that. I didn't understand how that process worked. I got it now. Okay.
Okay, so we don't have here, as far as I can see, a lot of high-risk populations. And that's what I've gone through before. We're not asking for variances. We have just kind of played it carefully, watching how things have turned out in our county and not tried to go, not claim that we're in protect our neighbors or, something extremely loose.
So let me make a statement then. Given that we're going to be meeting once a month for sure, and then on a need basis, then we need recommendations that we can act on. And in the past, we've done that. We've asked for variances when they're appropriate. If there was a request that would make us more constrained or less, it depends. So we're going to be looking at you to not just say, well, I'm trying to get by. You got to look at the lay of the land for us and bring the team together, whatever it may be consisted of, to make us good recommendations to decide the options that are available, not just a state gives me something to chew on what we need to know, put it in the context that the county it's relevant to the county.
Yeah, I try to tell you what the state has recommended, but I don't tell you that that's what it is for us. So in our percentage of activity, we're still in pretty good shape, but we don't have enough people tested to know what the real percentage is.
Which is an issue, isn't it?
It is an issue.
This county's got 5,000 people. And
That's right.
There's probably a bunch of them that don't even know they got it. Right?
Exactly so.
All right.
And that's why I'm pushing so hard. And it gets really old. I'm sure people are really bored with it. They're pushing so hard to wear the masks, not something that they have to pick up and recommend. Okay, and you can go on through the schools. Our schools are going to be continued in their closure, as I had let you know, and the schools have published and so on, until the 30th of November. So after Thanksgiving, once again, we will know a whole lot more at that time. So we go for the places of worship. That's obviously a contentious issue, but it does not really change between the orange, the yellow and the orange. So I'm not suggesting that we go one way or the other to make any movements at this time, again, until the end of this week. By that time, we'll be coming up on the weekend when most churches, not all, but most churches hold their services. So if we have, for instance, if we have another 7 or 8 positives, I'm going to be making recommendations, get together with the pastors and so on, and the families.
Okay.
Questions on any of that?
Well, I still come back to the question I posed the last time we met was, do we need a threshold for our county to dictate whether we move to a higher restricted level? In this case, it would be red.
Well, in this case, actually go from green to yellow and then to orange.
Correct.
Right.
I believe we're at orange currently.
And that's what I'm trying to
so
push,
I'm just saying, I think we should talk about having a threshold of positive cases for our county specifically to dictate whether or not we should move to red. We haven't had that discussion. I just bring that up that I think it's something we can talk about. We're at 17 this last week. In my opinion, that certainly warrants movement. I don't know what that number is, whether it's 5, whether it's 8, 7, as you indicated, as an example. What if we have 7 cases in 1 week in our county? I just think we need to have that conversation at some point.
We have to have that. along with other factors. It's not black and
Yes,
white.
exactly.
We did a black and white
Not
one.
just a number, it's precipitating
Just
factors.
because it came up
Well,
doesn't make it so.
I disagree to some, well, it doesn't matter what caused it. The fact is, do we have an increased number?
I didn't say what caused it. I said other factors like the where did it come from? What's the likelihood of it getting bigger? How does it affect our population? Again, we can move it however we think is the right answer for this county under the circumstances, besides a bunch of tests, because we don't know right now. If you really wanted to get serious, we don't know that there are people out there that have the disease at all.
Sure.
And so until we get a test to make it there, then it wouldn't move it at all.
But to
So-
answer your question, to speak directly to your issue that you raised, Tom, if we had some kind of a group traveling band or something that came in and they're all COVID positive and they infected a whole bunch of people, that would be.
That would be a circumstance,
Right.
which I think is what.
That's what I'm trying to point
That's what I'm-
talking about.
that's what
My
I'm trying to
point
talk
is,
about.
if our county, let's just throw out a number.
Yeah.
Let's say we have 15 positive cases in our county,
New cases.
new cases in 1 week.
Yes,
I would think that's a threshold to move.
yes.
That's all I'm saying. I'm not saying it has to be 15. I think we need to have a discussion and decide on what that number is. That's all I'm saying.
And we had 17 last week, which is why I'm not comfortable with green status anymore.
Well, clearly, I think green, blue, and yellow is about out the window with 17 in 1 week.
Yeah,
But
but we don't know.
Unless it stops.
Yeah,
We don't
that
know
was a
until we
one-time
get
shot.
test results.
Yeah, that was
It's because it was
spike.
1 week.
So we'll know, like I told you, we'll know a whole lot more Thursday, Friday.
Right.
Just redundant.
Do we have any idea? Whoops, I'm sorry, James. Let me ask a question. You guys have been patient. Do we know how many tests have been given? Is there a way to know how many people in this county are getting tests?
Again, it's 400.
Because they can do it on their own and we don't know.
And that's a problem. Because I don't know a lot of the tests when they come back.
See, I'm looking at the backlog. If all of a sudden we've got 1,000 tests done in a week, I'd expect a bigger number of positives. If it's 100, then we're going to keep eking along.
True. But I don't have any way of knowing, and except when these county directors contact me.
Unless we
tell me,
ask the public to let us know
Yeah, but
if they've had a test.
even when guys show up positive, I have people so angry that they say something like, I'm just doing this as my civic duty, nothing more, nothing less. I'm not going to do anything else. I'm just going to take myself out of the social life for a while. But they won't even talk. I mean,
Okay.
not only not share what they're going to do, but they won't share where they got tested and no information whatsoever. So I don't have access.
right, and those, you don't get a report on anything tested outside of the county.
Not at all.
And if those tests come back negative, you don't know that.
That's right.
And so the only thing that we technically can rely on is that stinking Cedars report on positive cases. That's
And-
it.
And the negatives that come back out of
Out of our-
particular
our own
clinic.
testing.
And so we're comparing all these other tests and
Right.
these to just our test negatives out of our clinic, which is not a valid.
And they communicate to you directly,
Oh, yeah,
the clinic,
yes,
Yeah, they call.
immediately.
only on all results, positive and negative?
Yes, yes. And then I call and contact the patients. Sometimes the investigators have already, because they picked up the information from another county or wherever, they have it before I get it. And that's when it doesn't even show up in Cedars.
So how do you get the ones that were done in Pueblo, for example? They get it reported on your own computer.
Yeah, the only way I get it is if somebody calls me up from one of the clinics and say, by the way, we got a positive from your
Right.
county, because it has
If
to
they
be
did it,
put
they're
in.
not required to do it, are they, or are they?
Well, yeah, we really do communicate between the counties. Like I try to support them, they try to support me.
But we could hear a week later instead of the day that they got it.
Yeah, but that's not the way we
Not
function,
okay, good.
okay? Trying to keep it as much ahead of Cedars, not wait until after, to get things we
It's
don't.
good to know the negative test as well.
Yeah, it would be nice, but they don't have time to call me specifically and give me all the Custer County negatives. I just don't.
You'll never
expect to
hear
see that.
So for example, I know, I don't think she'll mind, our administrative assistant was tested outside the county. You'll probably never know her results unless they hit Cedar.
Unless they hit Cedars, right? If they're positive, then it's gonna show up in Cedars eventually.
Should
But
anyway.
negative will
The
not.
negatives will not, exactly.
So we just, I think we have a big hole in the data
Yes, we
structure
do.
here.
Sure is.
You're absolutely correct.
So we have to deal with the positive cases that are reported to you through Cedars. That's really it.
That's right. That's why I was commenting before. I'm sure I didn't make myself clear. That's why I was commenting before. I can't give the percentage
Right.
like Denver can,
Right.
you know.
Yeah.
So that's why, you know, I don't like to come unprepared, but some of these things are not within my abilities.
So can you speak to on this chart?
That's the one on the colored.
Yes, clear down, the pages aren't numbered, I don't believe.
No, they're
So
not.
on bars,
He's on restaurants again. Hit it, yeah.
you were at restaurants, I can wait.
You just did houses of worship and now you're at a restaurant. If you're gonna go.
Yeah,
through this.
we're gonna, you're right. The
Okay.
restaurants is the
Okay.
next one.
So I jumped ahead a few lines, but that's okay. Go ahead.
Okay. So we had kind of an interesting situation show up with one of our restaurants where people were unmasked over Halloween and we had some positives. Not a lot, but we did have some positives, which for our small numbers makes a significant difference. And those are now all cleared from isolation. So, and they have the establishments that I'm referring to, I have gone in and cleaned, done their appropriate duty. And so they are appropriate for opening up again. Okay. Now, what the governor is going to say sometime this week, as far as closing everything, I don't know.
Sure.
But for restaurants right now, we're about 25% capacity.
Where does it say that?
You are, let's
You
see.
got the
it's
50 to 50 and then
1,
25
2,
to
3,
50.
4, 5, 6, 7, 8 kind of boxes up from the bottom of the
Right, I see
page.
that. No, I see the number. I was going from green to red
Yes.
or orange, but
And I'm
I see the
on
move.
orange right now.
so you might want to explain. It's,
Okay.
you got 50%, then you got
It was
25%, and then you
50% on
got
the yellow.
50 and 50, which means numbers by the calculator. So what does that mean?
So where their occupancy rate for seating capacity that is okayed by the state has been, for instance, if you took 100, now they're down to 25 within that institution.
Right, I see. And so what's the 50 mean?
The 50 means
Using the
the
calculator.
maximum number, even if you have
Right.
Right.
350
That's the point. That's what I'm trying to figure out.
capacity, yes.
So you could go up to 50 people only.
Maximum, yes. So that's why I gave to you, and it's online for all restaurants, the structures that we proposed, that we designed and proposed with our committees for restaurants to be able to put up additional, almost like a greenhouse, except you're sitting there eating and it's heated, for people who own restaurants to be able to expand their capacities out onto the sidewalks, whatever.
In other words, get your footprint bigger so you can get a
That's right.
higher head. count.
Exactly, exactly. And since they're separated, they don't add to the whole number of. the
And
restaurants.
you're going into each of the businesses to try to optimize their space. Is that what you're doing?
Yes, sir. Yes, sir.
Dr. Brown, on this chart, some of the boxes are highlighted in green and some are not. I'm trying to find a rhyme or reason. What are,
Those were changes. Okay, those are shifts from the old dial, quote unquote, system. These are all changes, and the others are the same exactly.
I'm good,
Okay.
thank you.
Yeah, I didn't give you a legend to be able
Yeah,
to.
if you post
So that was
this,
your recommendation, I said, well, that makes sense.
if you post this, be sure you explain it so people can understand it.
Okay, so going on down, we're not doing a lot of sports camps right now.
Well, let's go back to bars for a minute. if you don't mind.
Okay, yes, sir.
That's what I was gonna ask you about earlier.
Yes.
So according to this, as of Friday, they're gonna be closed down.
Bar, yeah, where it's not a bar and grill, where it's just a bar, just,
Correct,
Yes.
where they don't serve any food.
right.
For example, the Dome,
I was gonna ask, do we even have?
because those are two separate
Yeah, they are
businesses.
closed. They have been.
Yes,
They're not
they
even
have been
open
closed,
anyway.
correct. I'm just using that as an example of a bar versus a
So we've got a bar and a grill,
Chaffee's, for
Form
example.
canvas is a bar and a grill, I got it. Okay,
That's the
or
difference.
all of them, basically.
Yeah, that's how they become restaurants, right? Serving food.
So what does that mean then to the restaurants that have bars? They can still serve food.
Oh, yeah, that doesn't change.
Doesn't change anything,
No,
it's just the
doesn't
spacing.
change That's right.
All right.
Just the spacing. The gyms and the fitness centers are really gonna have to get clamped down on. So I assume it will be extended hours so they can have more people using their space. But they can't have them more than 25 inside.
Right.
Sports camps, we already kind of touched. Basically, as long as they're outdoors, we're probably in pretty good shape. Retail stores, I don't think we can very well shut down our grocery
Looks like they
stores.
all stayed pretty much the same.
They are remaining the same. If we go to red, nobody will be in the shopping aisles, but that would be your choices, in my opinion, not just the governor's. Next page, personal services. We are still about the same as where we were in the yellow. 25 people maximum. I assume these are hair salons and this type of thing. Healthcare settings, if you notice the health clinic, you have to be allowed in, and they do not allow in more than a certain number of people at any one period of time, so you're not sitting in there with a bunch of sick people threatening your own health. The indoor events, I have pretty well told the guys that called me, that asked, and said, I just don't think it's gonna be, we have too many irons in the fire right now, too many variables I can't predict. And so for you to put out a lot of money planning, I don't think it's fair.
What does that mean, indoor unseated? What kind of event would be happening up here?
Well, anything like if you went out to the fairgrounds and you didn't sit down, but you got to watch, you could stand around in a group. If you have a tennis match or something like this, but I can't imagine that happening during the winter here.
It's indoors, so
Yeah, it's
nothing that I
indoor
can
and
see.
city. Yeah, I don't think we have that kind of capability here. And so, like I told you, I've already really discouraged planned events for the indoor seated events, entertainment, outdoor. I don't think in the cold, we're gonna have much of this. That's, you tell me.
Just a quick question on indoor.
Yes.
School doing a basketball game as an indoor event. Did they stop their sports? I haven't
Right
heard.
now,
Haven't
I
talked to them.
believe, haven't they stopped? I thought that they had.
I thought so
I
too.
thought they stopped most of it. I thought
All
they
of
had
the,
re-
like the football team and so on, all
Right,
those
they
things.
did it in the spring is what they're planning.
Yes.
I just wondered what they were doing with
Depending on,
basketball.
they're still floating also.
Okay,
Don't know. Outdoor and seated, outdoor seated, that I've already said no to most of those, in fact, all of them now. And guided services, I'm not aware of anything. I suppose cross-country skiers, but that's not more than 10 anyway.
Okay.
Okay, and that pretty well covers the list. Do you guys have any specific questions other than what you've asked?
well, good job, thanks.
Yes, sir.
I appreciate it. Is it okay if I change the subject
Oh, please,
slightly?
go.
So the good news we've been hearing, and there hasn't been a lot, except two companies apparently have what appear to be potentially,
Better than 90%
yes, which is,
vaccine.
I'm not a medical person, but I'm learning that that's tremendous. And what I'm also learning is that both companies, one is very, very cold, like -90, and the other one is very cold also, that the vaccine needs to stay at a very cold temperature. Do you have any information that just isn't on the news on if it is public health going to be able to dispense this vaccine when it becomes available? And here's where I'm going with this. I'm going to just cut to the bottom line. We have some we have some money from the state that we could spend that's directly related to COVID. And it ends probably before the distribution of this vaccine happens. So should we consider refrigeration units or something to maintain these vaccines, if in fact we're even going to be the ones who give it out?
We have freezers right now that will meet the criterion, and their smallest group that they're willing to send out is 350.
50 doses of the vaccine?
Yeah, 350 doses, I'm sorry, yes. And we have the capability of keeping that frozen, okay? Now, do we have the capability of 70 below zero? Absolutely not. I don't want to spend just buku dollars buying a deep freeze with dry ice that is very, very short in supply right now.
Right.
So we do not have a definitive answer for you as far as who is going to get the initial. Okay, I mean they've broken into categories, early responders and all these things, but how much we are going to be parceled out, don't know yet. That remains to be seen.
We don't know even how they're going to disseminate it in the states yet.
No, for sure.
But somebody must be in the lead for the state, and maybe it would be worth checking to see who it is and getting sort of somebody prepared to.
We're online with those guys every day.
Okay.
Okay.
I think Jake's point is if coronavirus relief fund can pay for that, money can be used to pay for that freezer.
Could we do it first?
From what I've seen on the national news, it looks like it's -94 degrees. Would it make sense for us to hedge our bets and buy a freezer if it's available now, even though we don't know we're going to need it? I think that's a valid question. I don't know how
We'll find one once we find out that it's needed.
Right.
They'll all be gone.
Can we get it approved? That's right. Can we get reimbursed?
I don't know the answer.
We'd have to think about it.
Question.
That's a good question.
We can submit for it. Who knows?
Good.
If that's what you guys want to do,
We don't know.
but we have this other vaccine that doesn't require more than just a routine freezing,
Right.
that doesn't cost us anything additionally and lasts for more than 4 days, if it's not used, okay? Because we can keep it for a long time. So I am not confident that they're even going to send the tiny little communities this -70 below vaccine in the first place. And I think we are down the list a ways because we don't have a lot of nursing homes, restaurants,
That's a good question. They need to let us know because.
That's right.
I don't care if you're a big population or not. We care about our population.
Of course.
And we don't want to say that, okay, they're getting the vaccines and we're going to get it 6 months later.
But they are
We got to
going,
deal with it.
first of all, to high-risk populations. And we don't have a lot of those
Yeah.
here.
Right.
Okay, so and that's why I'm suggesting, I'm just postulating that that's how they're going to
Sure.
dispense.
Tom?
Cheryl, I request about a 3-minute break if you don't mind.
I looked at the second hand and the minutes there. It looks like it's time. Are we where you can stop? at
Sure,
a good
absolutely,
spot and we can come back?
absolutely.
All right, let's take 5 minutes.
I
We'll
want
be
to pick
back.
on this gentleman over here.
All right. We'll be back in 5 minutes. Take a quick break. meeting, and we had just gotten through part of what Dr. Brown has presented. Go ahead now.
Okay, thank you. To go further, since you are the ones who make the decisions as to where we are going to be and what we do here, I would, and Dr. Larson and I just talked about this outside. So the sunlight laws are totally in keeping, right? Anyway, we spoke of this, and there are parts and parcels of this community that might not be so important, essential workers, because we wanted to discuss those in Denver as they are here. In our hardware stores, in our car repair, I mean, trying to go any place or do anything if your car breaks down. Our food services, stores that will provide a pump if our water supply all of a sudden is kaput. Any type of medical services like our medical clinic, and just the general function that keeps people, when you talked about property, I know I have to come in here not only to pay my taxes, but to find out, property lines and any kind of zoning ordinance, to be able to keep things together and not cost me a whole bunch of money because I made a mistake and did something. To me, that's pretty important. And so that was the basis upon which I said, for our law and order, for our fire services, for our medical services, for the services that we provide in here, to allow people to keep functional in our community. It's different than buying a cigar, okay? And that's kind of, even though we don't have a lot of services, we have the people who do service here really provide an essential, to my way of thought, service to the community members here. So because they don't have other possibilities unless they want to go to Pueblo, where I don't want anybody going right now, or Canyon City or whatever.
Or Salida.
Lower Salida. So anyway, those are the reasons that I suggested we try to keep our county buildings here open to the public in some form. Do we have to keep, 14 people in one department? Well, no. But to me, it seems like there are things we should have at least by appointments, which is one of the things you guys brought up when we talked about this originally. If we can't keep a whole bunch of people in here fully staffed, then how about bringing in people who really need the service by appointment and have 1 or 2 people here instead of 5 or 6?
Which is what we did.
Right.
Yes, essentially. Yes, exactly. So anyway,
Okay,
I just
so-
wanted to speak to Jay's
Right.
comments.
I
So,
appreciate it.
and we can start now if you want.
Can I just respond?
Go ahead.
I'm 100% with you. And I fully understand if we can't fix a car, you can't drive yourself to the hospital. I understand a grocery store has to be open, someone's got to stock the shelves. Is that essential? Probably, because you can't eat. My only question was, and what I brought up was essential in this core room, in one office where there was potentially a hotspot. But I'm not going to disagree with one word you said about what is critical and essential. I agree with that. I mean, it's essential to have a cleaning person come to your house to clean your house. I don't know. That's up to you. You know what I'm saying? The cigar is perfectly. Can you do without the cigar? Well, I think you can, but you may not think you can. But you know what I'm saying?
Yes.
But I was really referring to the one incident we have in this building, and I didn't even suggest shutting the building down, just that office.
I see.
So I just want to clarify, but I don't disagree with what you're saying.
Okay, so that's what I wanted to get to now. Is there any more things you need to bring us up to speed
I
on?
don't think there's anything else that we really have to spend your time on.
Okay, what I proposed here, guys, is that I wrote down 4 or 5 things that we need to consider and take some action of some kind or not on, and you guys can add to it. But this fogging process, we need to nail down what we want to do via the fogging, whether it's getting somebody to give us a recommendation and then make a recommendation and solidify that on our next meeting. Or we could do it, we don't have to have a meeting to do that. We can do it via telephone if we wanted to, or some other process. The essential worker thing we just talked about, we need to agree that we have a reason to keep the businesses in business. And part of that, it requires the county to do its job. And even other things like that we came to the last time we limited work and we kept the road and bridges going. We were not, I don't see that as an issue right now. Or other activities that we need to consider. The request for CARES kinds of support is another action that we need to consider. Whether we buy a freezer, somebody brought up computers to consider or whatever. From a health point of view, we need to get our recommendations into the committee that handles approving the CARES activity. And then preparing for the EOC activities and the vaccines of the future. We could consider some of those things. Is there anything else that you see on the list that we want to talk about before we get started? Tom?
Well, I've got some other things I want to bring up whenever.
Well, if it makes sense now, so we can, are they things we're going to have to vote on or not?
No.
Okay, why don't we do that first then, Tom?
Well, so I think we need to dispel some rumors, for crying out loud. Just frustrates me. I can only speak from my perspective. I don't believe we have any plans to shut the county building down as of today. Would you gentlemen agree with that?
Yeah, that's my thought.
The treasurer's office has a tax lien sale scheduled for Friday that will occur in the courtroom. People will not be allowed in the county building. Somebody had mentioned to the treasurer that we were considering closing the county building this week. And I said, hell, I'm as in the dark as anybody, but no, not that I'm aware of. So wanted to make sure we got that on the record that as a Board of Health member, I have no intention of entertaining a motion to close the courthouse this week. That's me.
Okay, so that would, and we probably ought to put that as an action, something we can publicly vote on or not. Okay, go ahead.
Well, I'm just.
I just list out I agree, you're dispelling rumors.
The other thing I want to talk about are our temperature scanning equipment that is currently being used. Jeez Louise. I wish Vernon was in here, but.
What's the problem?
Well, there's not a problem. We are using those to scan temperatures.
I haven't
That
seen
is it. Hysteria runs amok in our county.
Well, I did see that.
Unnecessarily. We are using those to scan the temperature of employees and customers that come into the courthouse. It is on an honor system. We are not going, or have not at this point, dedicated an employee to stand there and scan people, nor do I think we will. I think this is a preventative measure that we all agreed and voted on to purchase that equipment and put in the county building. So I think it's working well. Hasn't taken a picture. Everybody gets their picture taken when they come in this county building, whether they know it or not, because we've got security cameras all over. Go ahead, sorry.
He didn't. I guess to reinforce that, there is no facial recognition going on and people being tracked.
Correct. This information is not retained. It is not saved on a database. It simply looks at your forehead. The reason your face is there so it knows how close to get, and it tells you what your temperature is. I did it 3 times already this morning and I was 97.1.
Did it work the same each time?
And I'm done. I mean, I just want to make sure if I was 100.1 or above, that is an indication that something is not right because you have a fever. It could be a common cold. It could be anything, but we would prefer you didn't come in here if you have a fever, whether it's COVID or just, a cold. don't spread it. So please go home. This is just a method for you to know. Please, we prefer you didn't come in.
Okay, let
I'm
me
just
say,
expounding upon what you said.
let me,
Tom. Thank
let me take a shot at that one too. The reason I wanted to and went along with that program was that why we bought them. It's better than having somebody paid at the door to stand there and scan your forehead to let you in. And it's more effective but it is an honor system. And so probably we need to maybe do we'll take a look at our posters to make sure they're explained out there a little bit
you.
better.
They do.
Maybe.
They're fine.
I think they are, but if we didn't say anything, take your temperature and you're on your iron system, stay out if it's above, but we did say you can't come in if it's above 100 degrees, 0.1.
Right.
So anyway, if we can, I think the way we're handling it's fine. I don't think we have to have an action to vote on anything.
There's nothing there, and it's really just a very, very small number. I think it's only one person who contacted me a number of times, and I did my best to explain. It's just a thermometer.
Right. Anything else, Tom? Keep going.
Yeah, I wanted to ask Cliff about the status of his advisory committee.
Okay.
Can you bring us up to date on that?
Yeah, okay. I was a little facetious, lighthearted with you when you sent me the list of names that you were suggesting, because it was exactly the same list of names that Jay had sent me. And we had the conversation relative to where these people are coming from. And this list met exactly. So I was being a little lighthearted there. But most of the people on the list are fine. I tried to send, I don't know if you guys were away from your computers by the time I got my email sent this morning, but I'm not limiting, in my mind, the advisory committee to anybody. I just gave you some names that I know that do represent certain factions and do provide information, but I am open for anybody who wants to come in. I don't care if they polish shoes or cut hooves or whatever they do. If they have something they want to say, I want to hear it. And I would like to be able to then present that to you as part of the global picture for whatever problem it is we're looking at. The one hole that I really had in the list that I gave you last time was social work. Well, we have an excellent social worker. So I talked to her on the phone a couple of times, and we've kind of set things up for action, and I think that will work out well. But all of the other people on the list that you sent me, Tom, great. Anybody who brings expertise or opinions that are working, functional, thoughts for people living and work, making the place work.
Which would be limited, not limited, but
no, but it
would be emergency specific expertise that's
right.
required, and you want people to get the best.
What are we facing?
Okay.
What are the component parts? Okay. So there's nothing written in stone here.
Well, the plan is to have you present the list after it's finalized, well, not finalized, but that we can look at maybe on the 24th and say this, we like the list, and that we might have some other suggestions.
Okay. But understand, there is people can come on and drop off. I'm just giving you the type of people that I want to see, that I want to pick the brains of. And we have an amazing community here, just totally amazing. The expertise living in this country. For a county this size, I'm just blown away. I'm in love. It's so good. So yeah, and anybody at any time who wants to pop in with an opinion or a new thought or verification of thoughts that have been presented, I want to hear it.
Understood. I guess my question is this. Are you going to have an advisory committee that meets on a regular basis, a group of people?
Probably not meeting on a regular basis, because I didn't see any reason until we, have to hash out problems or whatever, but to have a monthly meeting, I've been living in the government for a long time, and meetings are interesting. I find a lot of meetings to be of very little consequence, and I don't want to impose upon people's time. But any time that something comes up or something, somebody brings up a problem or something needs to be discussed, the numbers on the list are going to get
Well,
called.
for example, let me give you one. If the governor comes up with a recommendation of some kind of a move one way or the other, whether it's up or down or what, or mandatory or recommended, I would think he would want to pull a group together,
Absolutely.
not just of medical wizards.
Nope,
The right
not at all.
group to come and let us know what the
This is going to
options are.
affect all of our businesses, on and on.
So
Yes,
is it safe, I'm sorry, yeah, I just want to follow up on this.
Sorry.
So is it safe then to assume that you're going to have a list of resources, people that you could reach out to? It's not an advisory committee.
That's right. Oh, exactly.
Well,
It's
I
not a formal.
would like to put this whole advisory committee nightmare to bed. If you're not going to have one, you're not going to have one. If you're going to compile a list of people that you could reach out to as resources, fine.
Excellent.
I don't care either
It
way.
doesn't matter
I
either way,
just-
just you got to have people.
As long as we have contributions.
So that's, I'm not putting words in your mouth. I hope I'm asking the question, is it your plan then just to have a list of resources that you can reach out to?
Yeah, and resources or advice, a list of people who give advice. Yes, absolutely.
Thank you, appreciate it.
Jay, did you want to?
I just had a question, and I don't mean to pour salt in any wounds or create any issues. I'm just curious because it concerns me a lot. If the governor comes down and says, you must do X, Y, and Z, without enforcement, it's worthless.
And what I would do is come back to you. Come back to you
So-
guys.
What are your thoughts about, I mean, the pandemic obviously is getting worse, and our county has shown a spike.
Right.
And it's possible we have to do something significant.
Yes.
How do you feel about enforcement? Is this just going to be an honor system like it was previously? And I don't mean to put you on the spot, Dr. Brown. You're welcome to think about it.
Yeah.
But this has always been a little hot topic in my back of my mind, coming from a law enforcement and legal background.
Yeah, I don't think that we have a mandate to go out and iron hammer anybody. But I think that there will be, with sick people, the more people that we have within our midst, the more real I think this is going to become. Now, those are just my suspicions for human behavior, okay? And I think that we will have better compliance without iron fists when people realize this is real and it could affect somebody in their family. So I want to reason with people, but we may have to at some time have some kind of something from somebody to give us some power to do something about it. I know that in the Mississippi and Missouri River valleys, when yellow fever was coming through, they literally put boards across the doors and windows of their houses. I mean, they stopped the pandemic. I mean, it was killing people all over the place. I don't ever want to see anything like that here, but I can envisage a situation in which people would say to each other in our community, we've got to make this happen.
Well, I would agree with that, but when this started, and the governor was much more strict about what's happening at the moment, and we were in what I consider a lockdown, whatever you want to call it.
Yes, sir.
We did have a very small contingency of people who flagrantly violated it intentionally, posted those kind of pictures of them, you can't tell me what to do, and it goes on social media and that kind of stuff. And that's, That's the kind of thing I'm very concerned about, because those could be easily become super spreaders because they don't take the thing seriously. I saw somewhere this morning where a nurse was trying to convince a person who was about to die with COVID that it was real, because this person still didn't believe it was. Now, I'm never going to ask someone to change their feelings, but I'm not worried about you individually. I'm worried about if you ignore it, you may get Kara and Dr. Larson and everybody else sick. And unless someone says to you, look, you've got to stop this. And if you go, I'm not, here, go tell that to the judge. Here's a summons.
And that
I
is
don't
my
know if
option.
that's the right thing or not. I'm just asking because we're getting to a point where your personal freedoms could possibly be infringing on
Somebody
others.
else's, yes.
So, and I'm not putting you on the spot. I'm just telling you how I feel about it. So,
Well,
anyway,
that is, from what I've been reading in the law, and I've read it so many times now,
yeah, I know.
the only real viable enforcement that I have is to go before the judge and seek an injunction, seek an order.
I
seek action.
personally believe, and Glenn really is the one who wanted to ask this, I personally believe you have subpoena power to give someone a ticket and to make them answer to the judge. I'll leave that to Clint, but I believe the way I read the law, and I read it too many times, that you are entrusted to that power.
Yes, sir.
So, and I'm not asking you to do it. I know, I'm not trying to put you on the spot again, I promise you. I'm just concerned that if we don't have some kind of, I don't want to say penalty, but some kind of meat behind the recommendation, enforcement, good word. How are we gonna, what
And
good is it?
potentially, you know, if, well, it destroyed me last night to lose my llama. It destroys me to lose people. I haven't lost a single patient under my care, and I'm not about ready to start now.
Right.
So my thought is that if somebody forces the issue and we can see that they're spreading disease in our community, I will go before a judge. I mean, I'll do anything that I have to stop that person until they understand that they really are seriously an impediment, a danger to other people.
Okay. And I didn't mean to bring up an old wound. I mean, you know, old discussion that at times got a little testy. I'm just concerned. So I just wanted to express that concern again.
From what I understand, there's my options in that question.
Thank you.
Okay, good, thanks, Kay, and it is case dependent.
Yes.
And I'm sure good discussion, you'll take good action, I hope. Tom, did you get through your
I'm
list?
done, thank you.
Jay, you got any?
I'm good. Thank you.
Okay, so what I would propose is, we've answered some of these already. The advisory committee, we have a process for that. He's going to present a list. We'll see his advisors that he's going to have online on the 24th. He's going to have a resource list of people. We don't need to do any more on that, I don't think.
Yeah, I'm assuming we can drop the nomenclature advisory committee, correct? Because that
Absolutely.
And I
connotates
would
a
really
resource.
appreciate doing that.
Health Department
Nothing
resource.
but
Propane.
I mean, first of all, I commend you for having, I mean, nobody knows it all, nobody. So having people who may have additional information to get you call on makes perfectly great sense, but we don't need to call it a committee. I agree with that.
Can we pick on, before we go too much further, this gentleman over here has been very patiently waiting.
But yeah, I didn't know he had a purpose except to be here because he loves being in the meeting.
His wife said he has a purpose.
Well, I didn't know. I didn't see you brought him in. Go ahead.
No, literally, I wanted to have him express to you, because he expresses things well. When and if we have to choose, and it really is the three of you, your choice, and I just recommend, but when we have to choose people that we say, okay, these are our number ones for receiving the vaccine, because that's going to get to be a hot issue
Bring the vaccine up.
for a lot of people. I would like to have kind of a thought process that you have already developed, so you don't get hit with herd of thundering buffalo, you can say, okay, this is how we're gonna do it. We keep
Right.
it simple, we keep it calm.
Okay, so I had planned to bring up the
Okay.
vaccine
Okay.
so that we could have a process. And if the process is he's gonna give us some heads up so we can do some thinking, and you're gonna come back with a recommendation on how we're gonna disperse it or
Yes,
whatever,
sir.
that's good. And we don't have to do it today. We just need to know that we're gonna do it maybe on the 24th or in the mid-month meeting or whatever. So go ahead.
Well, we, in a public health setting, we've been through this a number of times. There was a shortage for an H1N1 flu a while back. And you all are going to have to make some of the decisions. But it's in many ways really pretty straightforward. I will tell you, at least in Los Angeles, it was very necessary to keep the government working. So government workers were actually some of the first people vaccinated.
Holy smokes. They're
I
gonna
may live
I mean,
propagate the bureaucracy.
I would have guessed first responders.
Yeah.
Well, it's hard to keep things moving if the government's not moving. And of course, we agree with the police and the fire department and the EMTs. Even if they're volunteers, we still need them as a
Absolutely.
They made that
as a
point earlier.
community. We need healthcare workers, our clinic to be able to work. After that, it's going to be a while because there's not going to be a lot of vaccine early. That's just the reality. Even if the two lead candidates both get approved soon, their ability to make vaccine is going to take some time.
Sure.
Then our at-risk population, which we all can probably agree on. And so it's not going to be as hard as we think, but at the same time, we have to recognize the groups that we're going to go down. And I think you've already come a long way, and there's probably even fairly substantial agreement among you already.
Well, Dr. Watson, I would think that as we get closer to knowing that vaccine will come here, then all the health care, the Board of Health with the advisory of you and whoever Dr. Brown, OEM bring in, I think then we could just go ahead and get a priority list started and work on that. But yeah, I mean, hearing what you're saying today about government, kind of surprising to me, but I guess it makes sense. I won't be me, but it'll be somebody. So yeah, I understand.
It'll be you till Christmas.
You're not getting a vaccine by Christmas, I promise you.
I happen to agree with you. I think that that's a very optimistic date.
Yeah, I don't think.
For Custer County, it borders on the ridiculous.
Well, it does.
Yeah.
Oh,
because
for Custer County, we can-
Yeah.
I think they said there's only like 9 million things that are gonna be available, and there's 300 million people. So
Well, I mean,
do the math.
well, exactly. And actually, first on the list before government is going to be the U.S. military.
Yeah.
Military is number one, for sure.
It is.
Gary,
They don't even bring it up.
agree with that. So we'll be a ways down the road. I think we'll have time to have a significant discussion and come up with a basic plan on how we're gonna.
So you guys, you got some idea how you want to handle that, Dr. Brown, because you can come to us with a recommendation and outline it, but we can throw holy water on it.
Good, absolutely, we'll do.
All right. Okay, anything else?
Thank you.
Okay, so if
Is
we,
that the conclusion of Mr. Larson's comments?
I don't know, that's what he said it was.
No, that's all I wanted to say.
Thank you.
All right, so from a vaccination point of view, we got that. Foggers, do we want to talk about foggers and make a recommendation? We had a suggestion earlier about once a week, hose it down and then wash it down and then do it in the next week. What do we want to do?
Well, my opinion is just fog it on Friday night after work and be done with it.
Not follow up with a desk scrub?
If I may make a comment.
Go ahead.
You have very responsible people that have worked in this courthouse and in here. And the reality is, she's got to be responsible for her space.
Right.
The people in there need to be responsible, and it's for their health, and they will do it. We're asking them to just.
So that's a very good point, because we can fog it on once a week and then the guys come in on Monday and wipe them.
Yes, and most, I think, your employees are wiping down things on a regular basis because they're working with the public.
Got a thought, Jay, more than once a week, less? Does that sound good? They're on the arm. What do you want to do?
I'm so torn on this. I would agree with once a week, although I really would love to have a definitive answer on how safe or unsafe this is. However, I believe it's safe enough once a week. We had once talked about doing it every night, overkill. And I think Dr. Larson's point is extremely well taken, and I think maybe we ought to send out a memo to the
That's right.
supervisors saying, we're going to be doing this on Friday nights. Please make sure your staff, the next time they come to work, because some people do work on Saturday, come to work to please clean their desk surfaces and their work areas for themselves.
Okay.
And I think that's a very good suggestion. I could live with once a week.
And I'd like to ask Dr. Brown to validate the percentage of whatever junk we're going to throw into the air. And then we're going to agree on, we're going to make sure, and no matter what, somebody is allergic to everything. So there's always going to be somebody. And if they are, let them identify themselves and they will make a special case of them doing something else or whatever.
I just want to make sure that the reward is greater than the risk. And that's the whole thing I'm concerned about.
Okay, so can we get mutual agreement here? We don't need
I can live with
once a week, memo out, people wash down their own workspace daily, hourly, however they want to do it.
I can live with it.
And I will get back to you guys on exactly what is being used.
Okay. And yeah, you get with Vernon, he did a lot of research and between the two of you, it ought to be.
And I haven't asked specifically if Vernon's ordered the foggers. I haven't seen the receipts for the
think,
CBRF.
I thought they did.
Yeah, he's sitting here.
Vernon, you order the foggers?
I was never told to order foggers. I thought we were borrowing from the sheriff's office.
We did until we got our own.
Oh, okay.
And that's kind of what I remember.
So I have a question.
We
I
actually
don't think we need two of
on
them
that.
personally, unless we
No,
worry
I-
about one
that's
breaking down.
Conversation I wanted to have, if he hadn't ordered them, I think we need to revisit that. a little
I do
bit.
too.
I think initially we talked about two to be able to have one for search and rescue, public health, the airport, road and bridge. I don't know that it's necessary for that. I'm confident, well, I know CBRF will approve that because they've already approved the purchase of some of them. So whatever we decide, I think it's almost been a moving target based on our experience, based on knowledge base.
The only thing I would
One
suggest
be
is
sufficient.
with two batteries.
Yeah, probably. I don't know what it
I
comes
don't know
with.
if you can get an extra battery, but if you can get an extra battery, Vernon, that's the thing to do. We were just talking, go ahead.
Extra
Tom.
battery for the,
Yeah, I mean, they had a little issue the other day because the battery wasn't charged up. I don't know how many batteries they have.
Just one.
So
all right,
maybe,
I will look into it and find out what we need to keep them going.
So we want to tell him to keep it going means go buy it.
well, I would move that we purchase a fogger. It's not the end all. I think it's just another proactive step. And
And
I'll
implement it.
guarantee if I made a motion, there's going to be people who disagree with it. But that's just the way it is.
Got a second?
I'll second it.
All right, it's been moved and seconded to buy a fogger with two batteries
Okay, we'll do it.
And accompanying solution,
and enough solution.
probably,
A gallon goes for a long time. Once you work with the sheriff, figure out how much, and then let's order an appropriate amount.
All right.
you haven't approved the motion.
I know it.
And some of the deals that where you buy the fogger, they give you a certain amount of the solution as part of the deal. When I
Okay,
was
we'll work.
looking through it. So.
All right, so it's been moved and seconded to buy a fogger, two batteries, and enough solution to get us started. Do I have a vote? Jake,
I vote aye.
Tom,
Aye.
Kanda, aye. Okay,
And we've agreed on once a week.
yeah,
Yeah.
that was the process. We agreed on once a week, and we're sending a memo out to the workforce, all the workforce in all the buildings.
Might I ask a question real quick?
Go ahead.
Vernon?
Yes, sir.
It's-
Here, I'll come in.
Good. When I was looking through things, you don't know the exact chemical concentration that they're using here versus what they're using in the sheriff's department?
What I was told at the sheriff's office was it was 0.23%
23, okay.
of, yes.
And what I saw, what I looked at
Mhm.
when I Googled it was the 0.05.
0.05, so that would be a,
5 times.
Times more.
4
yeah,
times.
so we would want to dilute it. if
Well,
that's the case.
0.05
Uh-huh.
versus 0.23,
Uh-huh.
yeah, 0.23 is 5 times as much, yeah. So we would want to dilute
Yeah,
if we could.
1/5 dilution.
So let me make it clear, then you can recommend from a public health point of view what the dilution rate of whatever we buy, because it could be different anyway. And it's gonna be the stuff
Okay,
you've researched.
we'll do.
And the reason that it cleans the
Nice.
air, not the surface, is that it settles.
Right.
When you don't have people in here stirring up the air, you have all this very
Okay.
fine mist that
Right.
we're not with the fog anymore. We're not swirling, it settles down. And so it can be wiped off, but we're gonna have to have some way to cover up all of our computers whenever it's gonna be
And
misted in
netbooks.
and out.
Okay, so the process you guys have to work out.
Okay,
That's not
I
something we're
just-
voting on now.
yeah, I just wanted to kind of bring this up so you know it's considered.
It's a very good point.
I'm fine letting the two of them determine what's the right solution.
We're not gonna sit here and vote on
What to do or what
that.
not to.
Okay, we've been moving a second to buy 1 fog or 2 batteries and work it once a week. How do you vote, Jay?
Aye.
Tom?
Okay, I thought we were.
No, I didn't think we did, didn't
Did
we?
you voted?
Oh,
Oh,
we did, yeah.
we just rehashed it. Okay, forget that
I'm
last,
still okay with
and I'm
it.
glad you voted aye.
No, wait a minute.
All right, let's go on. Well, we're talking about machines. What about the freezer? Do we want to make a decision? We can to decide now if we want to look into it or what.
Well, if,
We're gonna run out of money.
yeah, Mr. Chairman, here's what I'm thinking. We don't even know to what temperature we need. We don't know
I know.
which vaccine it's going to be. I think we're just being premature. It's kind of like making our list at the moment of priority
Wish
of
list.
giving out the vaccine.
Okay.
I think we're just premature at this
Okay,
point.
Tom,
Well, I would certainly like to have Dr. Brown look into that, make the inquiries. I understand the state has been given a set number of freezers. How they distribute that, who's gonna know?
well, they've already put freezers out in the state coffer,
So they're
so
like $45,000 a piece.
Yeah, so
I
would
can see
just
us
like
not
to-
buying one.
I would like to ask that you look into that.
Will
We
do.
have money. It's exactly what the money was designed for. It's a great example. If we need it, if we don't need it, I will support it. But if we believe we'll need it, we'd be crazy not to buy it through the CBRF program. That's my opinion.
Correct.
Okay, the other thing we discussed was a policy for taking temperatures. Are we beat that up? Are we good with just a memo or looking at the,
I'm fine with the way it is.
Well, I am too. I don't know if it needs to be more formalized or not,
I
but
don't think it does. If we agree to, let's just make sure the door is clear. And people need to know, they need to ask people to leave if they have a high temp, ask them a question or a mask, not wearing a mask.
I would think it'd be appropriate as a chairman if you could send out a memo
I'll do that.
to get it a little more formalized and
Yeah.
Board of Health is requesting or whatever that.
Put on the same
we not
memo
provide
with
service
foggers.
if you're not wearing a mask.
That's right. Okay, the other thing was essential workers. I think we've talked about that and we agree that the county business is essential at some level. Do we need to let the department heads decide? I think would be my recommendation. Let me finish. The amount of people they think are necessary to continue, because some things they can't do at home. And if they can do things at home, that's a good thing. Jay, you got a point. Go ahead.
I move that we quarantine based on the COVID definition of it, 14 days in isolation I don't want to use the word isolation, whether at home or when, for the clerk or recorder's office, because that is where the one person who tested positive within the last week worked and exposed the folks there. So I move that we do that for a 14-day period. And then part of the motion would be if people are late renewing anything that they do in that office, that we forego any late fees or any penalties for that.
I'm probably not gonna second the motion, doesn't mean it can't be seconded.
I'm not gonna say.
It could die for lack of a second. I'm just telling you how I feel.
I've talked to Kelly. She doesn't have any control on what fees to waive when it comes to motor vehicles. That's a state requirement or a state decision. I don't know what local stuff we would do, but that's just where I'm at.
Kelly's on, we could ask her opinion, but I would recommend that we allow our department heads to decide how to handle the workforce that's necessary to keep the business of the county going.
Mr. Chair, could I just suggest, we let my motion die and then discuss alternatives? We'll get a second either way, but let's
Okay.
follow the procedure.
Sure, I'm good.
If you don't
There's it's been moved and there's no second, so the motion dies for lack of a second. All right,
Died for lack of a second.
for a lack of support. All right, so alternatively, we've had several opinions. Now, I see Kelly's available to talk if we wanted to have her make a recommendation, or as one of the elected officials. That's my suggestion. Tom, you got a recommendation?
Suggestion about,
Well, it would be-
recommendation about what?
My recommendation would be to keep if we wanted to define it as a minimum workforce that's available. And then, of course, the people that had been, we have two pieces wrapped up in here, I think. It's people that are exposed at some point and know they are potentially exposed. Do we agree, or are we going to follow the recommendation from the state and our public health agency to allow them to be part of that essential workforce? If I don't have a problem, if the elected official decides they don't need them, that's fine, keep them at home as an extra precaution. But if they need them, I would allow them to make that decision.
May I
Go ahead.
contribute? I made some pretty careful inquiries, Kelly, of anybody that she could think of that she had been with, actually working close proximity physically with
For how long?
for 15 minutes or more.
Okay.
And there was only one. And so then I spoke with that person, and I won't share the name yet because I don't have her permission to do so, but she was very definitely interested in being separate, wearing her mask, being very careful. And we've had everybody tested, okay? So the mask precludes a lot of probable bad behavior. But the testing is the rest of the story as far as the state is concerned. If the people test negative and they're doing all the things they're supposed to do, yeah, then we don't really have to sweat the small stuff anymore, because so many of these people, she was not in contact for a prolonged period of time without a mask indoors. Okay, those are the criteria.
Yes, that's a good point, because our people have been wearing masks.
Right, exactly. And she comes in, she goes out. I mean, you don't have time to load the air with a concentration of virus sufficiently, dense to get somebody sick. Am I misspeaking?
No, it's actually my observation while I was here as an election official. So I spent 3 days here as an election official. I know Kelly. That represents what happened.
I don't think, even though people say, well, I walked in the same room, walking in the same room with a person doesn't infect you. It's this prolonged, heavily loaded viral air breathing in exposure that gets to you, okay, that hurts you. And people are scared, and boy, I understand being scared.
So asymptomatic people that don't sneeze because they're asymptomatic are less harmful.
Right.
Than somebody that's
Right.
hacking and wheezing,
Oh, yeah, absolutely.
even through a mask.
Even through a mask.
Okay.
Anyway, just wanted to throw that in.
All right, any suggestions? I think we need to write that in the form of a memo or agree that what we've got going so far is okay.
Well, my perception is that we have to respect the elected officials in their departments. I believe either Dr. Brown or the Board of Health has the authority to close down, or the county commissioners has the authority to close down the entire county building. But I'm not sure that we would have that same authority with individual elected officials' offices other than public health. Public health has the authority to shut down whoever they want in a pandemic, in a state of emergency. No question in my mind about that.
Well, even us as a Board of Health, probably.
So if Dr. Brown said, I believe that this department, A, B, or C, needs to be shut down, I would support that. I don't. But outside of that, I think it needs to rest with the elected officials on what they feel is best for their department. Given the fact they're not medical experts, that's why they would probably consult with the public health director and say, this is what happened, this is where we're at, this is what I think, what do you think? If that is in conflict, then I would defer to public health every time. So obviously I spoke to Kelly about whether she felt she should close her office down or not. She didn't feel that way. I'm assuming you had the same conversation. Yes, sir. And so I just feel like we need to kind of honor that. So I don't know if that answers your question or not, but that's kind of where I'm coming from as far as the departments in the county building goes. Courts are going to do whatever the courts do based on their chief
We can't
judge.
control that. So can I ask a question?
Sure, go ahead.
Based upon your suggestion, if a department head were to say, as hypothetical, were to say, look, if to any employees, if you feel so strongly that you don't want to come in, you could stay away for 2 weeks, and then you have to come back. Are we going to pay them, or are we not going to pay them? Are they going to have benefits? Are they going to accrue? I mean, you're basically giving the department has the right to give anybody a free 2-week vacation, if that's how you feel.
Well, that was how we were going to do it the other way too.
Well,
But the point is,
I never suggested any of what was brought up now. The only thing I was suggesting, hang on, the only thing that was in my motion was the one office where the supervisor was in close contact with the employees. That office should be quarantined. And it died on like a second, and I'm fine with that. I'm not hashing it, but that's different than saying each department head could determine what policy they want.
well, maybe it should be in specific. The specific would be on people that have been identified as the ones that would be essential workers quarantined, the way we've defined it, meaning they can come with the mask. So I would.
I personally don't feel anybody in this courthouse.
I would think that.
That's my personal opinion.
But I'm just telling you that I'll quit using that as a term. It's the policy that we're looking at is continuing to work with what the state and the health department have determined are safe. Now, if the public doesn't, and the public has the option, we've already done that. And the people, that's just the department, in the department, I haven't heard anybody, as a matter of fact, I've gotten positive feedback from the people that have been, quote, quarantined, that they're good with what we're doing. So if in that off chance there is somebody that isn't, then maybe that's
So
something.
there is, there's one person in that office who has chosen not to come in with her,
Okay.
with her supervisors,
Okay, so,
so it's not.
but see that, but what I meant then that meant that supervisor, I can get by without you for now. And if the positive tests come back negative, meaning the test would come back negative, and then she can come back to work. I'm going to keep her out for 14 days just because.
Well, according to the state, she should.
No,
Yeah,
Now, once they get, if everybody was negative tested, there's no reason. Just
Well, we don't know that. We haven't gotten the results back.
Cliff, Dr. Cliff, Brown, how would you handle
But that is,
the negative tests that come back?
as soon as they test negative, then they're free to go.
Right.
Go.
She hasn't.
I know, that's why I said when they get the results back.
no, you didn't say that.
Yeah, I did.
You're
Well, that's what I meant. Okay, I'm
sorry,
sorry.
maybe what you meant, I don't know.
Okay. If,
It's okay, I'm not trying, look, my number one, safety and health for our employees and the people coming here. Unduly exposing them is something I'm really concerned about. If it's essential, like a police officer, different animal completely. Renewing your car registration, I don't feel is an essential duty.
um,
And that's just me. And I understand, I brought it, I'm not
Okay.
rehashing it, but what I'm trying to do is retort to what you just said. I think if a supervisor can make that decision, then the supervisor is basically allowing people to take time off. And my question was, if that's the case, will it be with pay or without?
we
pay?
have that issue now, Jay, in the real world. People come to and say, I need the day off. I've got allergies. I'm worried about whatever. We have that ability that the boss can always let you do that. Now,
That's on policy, that's.
I know it. Let me say something. I've only said it once. It is essential, and I had this conversation with Kelly, for people to work. That's as essential as making sure that they can hide and not get the virus, because if they can't work, they die because they can't pay their mortgage. But Kelly even brought that up to me. If you can't pay your mortgage, what good is it? And luckily, we have the luxury in a government job where everybody says, well, you're going to get paid anyway. But that's
the
not true.
discussion,
with
That's
the other.
not the solution.
That's what you're asking about, correct?
That's what I'm
I
asking.
know. So anyway,
And I think as far as elected officials go, that's probably needs to be an elected official's decision. I don't know about that. We're in such gray, murky water. Hell, if you look at the wheel, offices should be operating at 25% capacity.
Right.
So either we do or we don't, or we just tread water, which is what we've been doing, is treading water.
or you make sure that they are wearing these KN95 masks and distancing themselves if it's required and deemed acceptable by the public health agency, and meaning us too. All right, so what are we gonna do? What I think we have sort of established the policy already. Do you want to continue it, or do we want to formalize it in a different way?
Well, I guess I'm a little lost.
Well, we're going to allow the public elected officials to make that decision. We can formalize that,
To make what decision?
whether they allow that person to go home, to man their office appropriately in the situation that they're in, whether they have a person that's been tested that was exposed, or whether, I don't think there is an option other than that. People have to come to work, unless we tell them to stay home.
Yeah, my gut feeling is that elected officials run their own departments.
Yeah.
I think they are subservient to the public health director's orders.
Yeah.
That's where I'm coming from. I've got other issues I want to discuss, but that's the best I can
If I
answer.
could respond, I respectfully disagree. Respectfully, I feel that we, Board of Health or Board of County Commissioners, either way, determine the policy on paying employees who are not coming to work for whatever reason. And we could say we're authorizing the supervisors to let people go home with pay or without pay, but we need to set the policy on whether they can do that or not.
I would agree.
Okay.
One thing that I do know, and I'm fairly certain of this, by statute, if you're placed in quarantine, you cannot not pay them.
I sure haven't seen it. I don't know.
Show me that
That's
one.
my understanding.
I,
It's a statute that says,
Not in this.
some people have been gaming that a little bit because they've been, this is me talking to it. I can't remember who it even was. It was a state. I don't remember. That they were allowing vacation time and this COVID 14 requirement. If they're quarantined by the quote, the law on the emergency, you have to pay it.
must be in a different.
And I'll let Dr. Brad probably can research that, but I believe that's the case.
Yeah, but
So anyway,
Well, and that, I don't think the Board of Health has any authority to decide who's gonna get paid and who doesn't get paid. I think that's either Board of County Commissioners or elected officials.
that's what I said. And the state said if they're in quarantine, that was the statute. No, we need to verify that. But anyway, so I'll make the motion. Then I move we allow the department heads to manage their departments responsibly. We want to put that in there to continue the business of the county. That would allow them the flexibility. This is an aside, to let them work at home if it's possible, if they deem that's the right thing to do, or operate here on their machines here. So I move to do that.
I'll second the motion with a friendly amendment to say, to add to the language of that motion, unless public health director orders them otherwise. I do believe
That could happen anyway, can it? Do we have to have that? I mean, I agree. The public health office can step in on anybody, anytime, if it's appropriate. But I don't have a problem with that.
Could you perhaps, and I'm not a part of this, but could you perhaps just say in coordination with the supervisors, in
Sure.
coordination with?
I would hope that, but that's probably a better way to say it, because you would want to do that because you could come up with ways to organize the office so it's safe and they can man it better, or whatever they get.
Or flat, order them to close.
Or close it.
So, yeah, I don't have a problem with that language in coordination with the public health director.
Okay. Right, that's the motion.
I
As
did second
amended.
it.
And you second it. All right. Any discussion from anybody?
please, I'm not trying to kill a dead horse. Maybe I just didn't
Well,
understand. But if a supervisor says, an employee comes to supervisor and says, look, I spent 45 minutes with a person who's positive. They took their mask off to scratch their nose and drink their coffee and have their popcorn or whatever. I'm very concerned. I would like to be quarantined from this office until either my test comes back or for 14 days, whatever. The question really is, whatever the reason is, would we be paying them if the supervisor
Yes.
agrees?
Yes.
Because that wasn't in the motion, and I just want to make sure. I don't want to send employees who are concerned about their health home without pay, and they have to say, well, hell, I need to make my rent payment. I'm going to
And
work with them.
the other day, recall, we said, if you don't get tested, we're not going to pay you while you're quarantined. You can't do that. And I did ask that question. So it is
That was
real.
just
We
a cluster all the way
have to pay.
through that
We do have to pay them. So, but we'll verify. But yes, it does. We will.
There was a memo sent out to the supervisor that said without pay.
Not that-
There was one.
No, it was, you must have the test as a requirement of the job. That's how it came out. Without pay was what we had originally hit, and then that was wrong, was taken out.
Okay, they're getting paid, and I can live with it.
Okay. All right, good move. Any public comment?
You know, unmute.
You want to mute them?
Nobody's unmuting.
They can unmute themselves.
I can't unmute them, they unmute themselves.
That's fine. I just want to make sure.
All right, there's no comment publicly, so we'll entertain the vote. Jay?
I vote aye.
Tom?
Aye.
Kanda, aye. Do we need to do anything on the follow-up on the EOC level? I don't think we do. How about the message board?
Well, maybe we do. I mean, and I'll just ask it around. I mean, my understanding is, and correct me if I'm wrong, we're currently at yellow for the county. Is it your recommendation that, because we clarified that we feel it's appropriate for the Board of Health to determine what level we're at. Is it your recommendation we move to orange or stay where we are? And I don't mean.
No, it's my recommendation to move from green to
To
yellow.
yellow is where it's
And
at.
then
I thought we were yellow.
no, we were actually green because we had virtually no one we had to worry about, and that flew very well with the state. Now, the state was yellow, okay? But I kept in contact with them and said, man, as long as you guys are doing well, hang in there. You're much more sensitive to what your people are than what we are at the state level.
So
Does that not make sense?
no, it doesn't.
Okay, go ahead.
If the state says, the state's at one level, but each county can say.
Yes,
we're at a different
Yes,
level.
exactly.
Okay, that's fine, I didn't
Exactly,
understand.
yes, that's exactly it.
Okay, so I move based on recommendation from our Director of Public Health that we move from green to yellow at this time.
So I have a second. I don't know why we wouldn't.
Guess it died for lack of a second.
No, I'll second it.
Okay.
I don't have a problem with that.
And you know that I will get in contact with you, all three of you, immediately if it looks like we're going not in a good place.
Well, that would be the right thing to do. Or if we'll have a discussion because it could require a variance. But from green to yellow is a minor change right now.
Yes, sir.
Okay. Any public discussion?
Hey, Bill,
Go ahead.
Lucas.
Lucas,
So if I'm to understand correctly, we were level green, protect our neighbors as far as the county is concerned, even though the state had us. And now we're going to move to yellow from level green, so we're going to move 2 levels.
no, it was, what was it? Blue, green, where were we?
Green, blue, yellow.
Doesn't matter.
Orange, red, and
Thanks, Lucas.
We were at blue,
All right.
we were moving to yellow, and if this week is another picture of last week, then I'll recommend again that we move to orange.
If it's not, what would you do?
If it's not, we'll stay at yellow and monitor for at least another week, because then we have Thanksgiving
Possibly go down or up?
and we can go down or up. It depends on what happens.
Okay. Lucas, could you hear that?
He bailed off.
Yes, thank you very much for that clarification.
Okay.
then the motion may not have been appropriate because I thought I said from green to
Yeah,
yellow.
you did.
And I should have been blue to yellow.
Yes, sir.
Okay,
Yeah, I think you did say.
thanks, Lucas.
All right.
So
Any other
I would, if that's the case, I'd like to amend my motion to change that we move from level blue to yellow level effective immediately.
Okay, I don't have a problem with that. I know that we probably should abandon the last motion, but I think we can.
No, you could seconded the original.
I second the original, so I'll
amendment.
second the change.
Is that correct, Tom?
That's correct.
All right, any other discussion?
Well, I won't support it in good conscience. We had 17 freaking positives in 1 week. I will not support this motion. We need to be at orange.
Okay. Any other discussion?
Under what criteria do you feel we should be at orange?
We had
The only reason I went to
17,
yellow is because the Director of Public Health recommended it.
okay, because we had 17 positive cases in 1 week.
Go ahead, Cliff.
Remember that we are looking at some very different, some changes, like we talked about. We all of a sudden had a whole bunch of tests done. So we don't know yet, which is why I haven't moved us to orange yet. We don't know yet whether we're going to have another 7 or 8 or 9 or, hopefully never 17
Or less.
again. But we have been in level green, protect your neighbors functionally for a long time because we had no cases at all, additional cases I'm talking about, of positives. But so we were just kind of letting things lie on a level blue and watching. And that's what we're doing now, except we're shifting to yellow, and we may have to shift to orange, we may have to shift to red. I don't know yet.
So my point of contention would be, I don't have a problem with that, especially since we'll get data here toward the end of this week, and we can always up the game.
Yes, sir.
And change it. That's pretty easy to do, and we're going to be meeting on the 18th. Is it the 18th? No, it's the 16th of December. It's the 24th. We're going to be meeting. We can formally increase it, or we can do it if we needed to. If it was a significant change.
Come on. Man, I'm going to support this because we put our faith in our public health director. And I agree that we had a 30% or more spike in 1 week. And if, like we just talked about, the department heads making decisions on who should come to work and who shouldn't, we're giving them the authority and the responsibility. And I feel we gave that to public health director, and he feels our yellow is the correct answer. I'll go with it. And obviously, if you feel we need to go to orange or red or purple or black, whatever, you'll tell us, and I'm going to probably support that too. That's why we hired you, to give us these recommendations.
All right. Any other comments? Hearing none, let's take the vote. Jay?
Aye.
Tom?
Nay.
Kanda? Aye. Okay. And so that was that. I think we got through everything I wrote down. Is there anything else that we need to discuss? You had something else, I think, Tom.
I do. I don't want to beat it to death, but I think we need to talk about what went on last week. I don't understand why I would get an email from Vernon, copied an email that was sent from Vernon to Kara, our admin assistant, that starts out on, based on the information from the state and CTSI, Commissioner Cannon has suggested this be the information released to the employees who work at the county building, which is in direct opposition of what the three of us agreed we were going to send out to the employees who work at the county building. I don't know if this is a BOCC matter or if this is a Board of Health matter. It had to do with COVID, so I bring it up in the Board of Health meeting. I was going to say I thought, that's not true. I know we left the meeting in agreement of how we were going to handle that. And then next day, it is totally changed. Where do you get the authority to do that, Bill?
I didn't.
Yes,
No,
you did, because it's changed. Unless Vernon's lying to us.
No.
He said that you told him that all county employees who work at the county building will be required to wear a mask and must get a COVID test between Thursday and Sunday. We never agreed on that.
What I have is what we agreed to on the note, that all I did was take it and reorganize it. And this is what was written by us in that meeting.
We didn't write anything, so don't say that.
We had Dr. Brown and Adrian Washington were taking notes, and we left the meeting, and we clearly said all county employees who report to work in county buildings are required as a condition of employment in the county workplace to be fitted and wear an the KN95 mask due to the COVID quarantine. Additionally, as a condition of employment, quarantine period of all employees who work in the county courthouse building must undergo a COVID test between Thursday, 12 November and Sunday, 15 November. Anyone may refuse the free test. And that what concerned me there is that we said as a condition of employment, we all agreed to that. And so that was what was paraphrased here. And then I asked Vernon, who had come in during that meeting because he had talked to the state official and said that we couldn't do that. And then I asked him when I had started rewriting this to put it out, I asked him to check with the state officials, and he said they reversed their position. And that was how it came out. And this all occurred late that night and early the next morning. And we wanted to make sure people had the notice so they could get the tests. Did not change the intent or what we had agreed to. Vernon?
Well, it did change the intent, and it did agree to change what we agreed to.
Vernon, go ahead.
What's the question here? I received an email, I guess it came in the evening. I received the email in the morning, or I checked my email in the morning, and that's what I posted out.
I asked Vernon to get it out as soon as he
point of
could.
clarification, it was CTSI, our insurance company's lawyers, not the
Right.
state lawyers
Right.
that I spoke to. So.
Right. And they said we could not say as a condition of employment, and that they finally said during the quarantine, we could not. How did they say it?
Initially, they stated, I apologize, go ahead.
Here's the discussion, and I remember very clearly. The question came up, can we require our employees to get a COVID test? That was the question. And we didn't know. We asked Clint, gave us an opinion, and we said, hey, someone said, I don't remember who, it might have been you, Bill, said, hey, let's ask CTSI because that's who handles our insurance. And Vernon came back and said, you cannot force an employee to get a COVID test. That's the way I remember leaving it.
And so when
And we left it with the words, we strongly encourage,
Right.
we just decided that's how we were going to handle it.
so
And it
after
changed since then.
that, because of that statement, I asked Vernon and I called Clint that evening as well to get his, and I had him read that statement and what we had discussed when we called Clint up initially. You know, he had said, I forget what you did say, but it was, we could ask them to take the test or not.
I said you couldn't force them to take the test.
Correct.
And
That was what was reported.
then that's when I asked him, how do we handle that? And asked Vernon to check back with his point of contact and ask him what we should say there, because that's what we had in the.
Bill, I almost fell out of my chair when I read that, because what it applied to me is if you did not take it during this period of time with the caveat as a conditional employment, you would be fired. And that broke me apart. I couldn't believe that came out.
Well, that was what they recommended saying, and I ran that by Clint.
Clint is not,
Well,
Clint is a great guy, but he's not the Board of County Commissioners
know
or the
that.
Board of Health.
well,
We needed to
we
make
had-
that as collectively decision.
I sent it out immediately that night, and I never heard back from
Send
him.
it out to who? This came from
I sent
Vernon.
it to each of you.
It was already out. You didn't ask me if it
I
was
said I
okay
need
for me
it
to send that.
tonight. I asked for a reply tonight because we needed to get it out.
No, sir.
Well,
You sent it out.
no, I didn't that
And
night.
when I read it, I said, are we going to terminate employees who don't get, what if they have, some other disease? Let's say they have the flu
That's
and they
right.
choose not to go get the
And
COVID
that's
test.
what,
They terminate
but
it.
that's
That's
it.
what that
That's
read.
what people do and have a discussion on why couldn't you take the test. I didn't say you would immediately not go.
As a
That's not-
condition of employment says to me that if you don't
but
do
don't
it,
you-
you're unemployed.
It's your condition of employment. Don't you work with your supervisor to understand it? That's what I would do.
Must get a COVID test between Thursday and Sunday as a
Right.
condition of
As a
employment. If
condition
you
of-
don't,
Right.
you'll be terminated. That's what condition.
No, it
of
doesn't say
employment-
we'll be terminated.
That's what condition of employment means.
I think the real issue here is that, in my opinion, it's just my opinion, Bill, you overstepped your bounds
Okay,
by making that decision, sending that out. without having concurrence from at least 2/3 of us.
All right. Okay.
That's my opinion.
That's fine.
Okay.
So that was part of what I thought was a very dysfunctional group that met last week. Very frustrating for me.
Why didn't either one of you call me?
If we send out a press release, which I thought we did,
Yeah, and the press release was very,
see if I can find it
it was
here.
up above. And it was pretty clear, and that was what we had talked about.
I can pull it up.
Want me to read it?
Maybe copy. Yeah, I'm very interested in you reading the very first sentence, please, of a press release about COVID-19 and a positive test that came back to one of our county employees.
Let's see, I don't know if I even have it now. I don't have it here. I had picked up the wrong one. See, 11 November 20. I don't have it here. I'll have to pull it up.
Well, we'll get it. Yeah.
Find it.
And that came from Vernon, as I recall. Is that correct, Vernon?
Yes, sir. I received that email in the evening and I opened it at 7:30 in the morning that morning.
That was Monday morning, right?
I believe it was Thursday morning.
Looks like now I'm back. Sorry.
Dr. Brown, do you have a copy of it?
I don't have it sitting in front of me, I'm sorry. I had it sitting on my desk when I left, and I don't have it here.
Yes.
Basically, what happened, from my memory, was that we got then a second opinion from lawyers, from another set of lawyers, and I don't remember who was contacted, saying that we could make it a condition of employment, or in other words, if they're going to come to work or if they're going to get paid, they had to take a test.
Well, I had it before the meeting started.
I
find
did
it,
too,
so.
and I don't know where it is.
Well, I'll say this, it's not going to be very popular, and I don't really care. I didn't appreciate reading a press release about COVID with an opening statement addressing a holiday. I don't know who wrote it. It wasn't accurate. It was unnecessary. It was not relevant to a COVID case addressing us.
That's not
A
what I
holiday.
wrote. That wasn't the thing that I sent out there. That was something that got sent out earlier.
I didn't say you sent it out. I said it was a press release that went out. There was errors in that,
There were liars in it.
and I don't appreciate that.
And I
And I
didn't.
guarantee you, I will not support another press release that has anything to do with the Board of Health unless I see it before it goes out. I thought,
I did not see this one either, Tom. I'll tell you that right now. This is not what I did.
Not blaming
I'm
you.
not saying you did,
Okay, well
Bill.
then tell me your point. Your point is we needed to see the press release. Although I don't think we need to see all press releases.
Well,
We haven't in
you
the
feel
past.
differently than I do then, because I'm done with this.
Maybe so.
The county positive test did not originate in the commissioner's office. That's what the press release said that went to the public. And that is absolutely unacceptable. Again, I don't know who wrote the press release. I wasn't privy to that. But when I got it, the first thing I said was, who in the hell wrote this stuff? Because it is not accurate. That was my point.
The holiday, are you talking, Bill, Tom, about the days that,
It started off, I've got that. It started off, we wished all veterans a happy Veterans Day, and now I had an objection to that also.
Really, because I didn't hear you bring it up, Bill.
I didn't bring that up.
May I see that, please?
This is what went out.
This is exactly
The
what
day,
I'm talking about.
the day we were in that meeting is when that was on the
This is
table.
exactly the press release I'm talking about.
That's exactly right. But the one I fixed, I want to pull that up.
So I made my point.
I like that point too. It's legit.
Well, I wish you'd have said something about it if you like.
I-
I move we adjourn.
Not until I get my press release up here that I printed.
You have a motion on the floor, sir. It's your obligation to deal
Does
with it.
anybody second it?
So before I'm going to second it, but I have discussion. Can I discuss it? Or is it not kosher?
No,
The motion to adjourn is not debatable.
that's right.
Then I'm not going to,
I do want to get out what I corrected because I didn't like that either. Well, I can do that later.
so when I ask this question, Mr. Chairman, is there any other business to come before the Board of Health?
Not that I have.
I second the motion.
Okay, it's been moved and seconded adjourn. Not, we can debate it, but it's not debatable.
We can't debate it.
It's where meetings adjourned.
Well, it's a motion. It needs to be voted on.
Okay, that's true. There's two ways we can do it. I always get them backwards. Right, Jay? Motion to
But I
adjourn.
want to say nay, just to be a
Go ahead.
pain in the butt, but I'll
I'm
say
good
nay.
with adjourning. Tom? I hear. All right. Now,